What's up, everybody? It is 5:30 on the dot. Today is Monday. It is Labor Day. What is going on? Y'all already know what the deal is. Ain't nobody in here listening to me talk because ain't nobody in here yet. Ain't nobody in here yet. But it's all good. It's all good, baby. Y'all already know what the deal is. You already know what's up. How y'all doing? How y'all doing? How y'all doing? How y'all doing? Yes, Lord. Today is Monday. Today is Monday. What's going on, everybody? How are y'all doing? Today's Monday. Hope everybody's having a good Labor Day weekend. Wait for some people to pop up in here before, before we start talking about stuff. Is I got a filter on? I don't even know. I don't even know what's going on right now. I don't even know what's going on right now. What's going on, everybody? How are y'all doing? How y'all doing? Hey, make sure y'all say hi. Don't be rude, all right? Be nice. Be nice up in here. Today's Monday. Make sure you guys smash. Oh, y'all already smashing the like button? Baby, that's what I'm talking about. Some comments in this live were filtered to protect the... Okay, I don't know what y'all up in there saying, but TikTok ain't liking what y'all talking about. You know what I'm saying? So, shout out to y'all. What's going on? How are y'all doing? Waiting for everybody to roll in because you already know what we doing today. You already know what we doing. We're going to talk about some stuff, talk about nursing stuff, and then we're going to get into it. Then we're going to get into it. Shout out to all y'all that are up in here. Hey, I want to know who you are, where you're from, where you're at in your nursing journey. Let's talk about it. Let's talk about it. Hey, y'all peep the shirt? Y'all peep it? Just saying. Just saying. It's there. It's there. So I'm actually going to be updating like my logos and all kinds of stuff. And some people were asking if they could like get this shirt. And if you want to get this shirt, you can just go to my website, thebootnurse.com, and then go to store, and then you'll find it in there. But I'm actually going to be updating like all the apparel and stuff over there because, things change and things grow, things evolve. You know what I'm saying? So here goes. Okay. Shout out to all 7 of y'all that are in here. If you guys are new here, welcome. My name is Kevin. I go by the Boot Nurse. So make sure you guys let me know who you are, where you're from, and all that good stuff. AR, just applied. Now my nerves are on edge. Who's that lovely Leo? Was AR. Is that Arkansas? Arkansas? Is that how you say it? I'm pretty sure I just said it wrong in a disrespectful manner towards you, and I don't mean that because I respect you. But it's okay to be nervous. Like, you're going into another step, and you're doing another step in the journey of becoming a nurse, and it's a part of the journey. It's a part of the journey. You're going to do all right. So the best thing I would tell you is that since you just applied, prepare. Prepare. Like, I don't know if you're doing an LVN program. I don't know if you're doing RN, a 2-year RN or a 4-year RN, but just get prepared. Brush up on that. If you still got prerequisites to take, take those prereqs, but brush up on the anatomy, physiology, all those pharmacology. If you haven't taken that yet, be ready. Be ready for that nonsense called pharm. Oh, yeah, 2 years. Okay. I see that 2-year RN. I see. Hey, shout out to all 33 of y'all up in here. Y'all already know what we're doing. Make sure you guys smash that like button. You guys are new here. My name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys go over there and check that out. Today, we doing the same thing that we do every Monday, Wednesday, and Friday. Y'all going to sit here, listen to me, run my mouth. We're going to talk about nursing stuff, NCLEX stuff. We might do some NCLEX style questions depending on how properly motivated I am based off of y'all. Hey, just letting y'all know that they right here. They right here. So based off of the request of somebody from the last stream, they said they wanted to go over pharmacology questions. So I guess I'll oblige the pharmacology questions. So shout out to y'all. Hey, you guys want to start doing some other questions? You guys just let me know. And then I'll just decide whether or not I want to read your comment. All right. I'm a physical therapist, but love these questions. Hey, shout out to you, Bree. That's okay. Cool. That's hard to be a physical therapist. You know what I'm saying? Look, everybody need to be, tweaked out, I guess. You know what I'm saying? I've been to physical therapy once or twice. So, I'm out of here. Farm, be beat. Nah. Rochelle. Nah. You ain't going nowhere. You stay right there. You want to know why? Because I don't even know what you're running from. Because pharmacology is always going to be here. It don't matter. Pharmacology is here before school, during school, after school. Hey, trust me, you start trying to data dump pharmacology, it's going to be the worst decision you ever make. Because next thing you know, you're going to go out there and they're going to be like, hey, I need for you to give some acetaminophen. And you're going to be like, what's that? And I'm going to be like, you know what? Just go ahead and excuse yourself. Just go ahead and leave. Yes, I'm always knowing other disciplines, that's right, better interdisciplinary care. That's right, because you are part of the interdisciplinary team. I actually made a lecture on collaboration with the interdisciplinary team. What people don't realize is that that is a category on NCLEX. It's a part of oh my God, management of care. So it's good that you know that, because the more that you know and the more that you understand, the better, So shout out to you. Shout out to all 88 people that are in here listening to me run my mouth. Hey, make sure you guys like that. Make sure you guys share, and you guys subscribe to my YouTube channel. I'm sorry, I kind of just go through that whole YouTube spiel, and I ain't even gonna lie to y'all. Like, no cap. I think that's what the kids are saying nowadays. But I was tired. Like, I was sleepy before I got on here. And now all of a sudden I got this burst of energy. And I already know it's because of y'all, and I appreciate y'all for being here. So Mariposa said, people told me to go to school for social work and not RN because they don't make money. Why? Ma'am, I would not be no social worker, but that's just me. And so here's another thing. And this isn't towards you, Mariposa, but you just kind of brought that up. People are always going to do a bunch of this. They're going to always do a bunch of this. So you can actually navigate your way through anything. If you want to go to social work, baby, go be a social worker. If you want to be an RN, if you want to be an LPN, I don't give a damn if you want to be an underwater basket weaver. If you want to go do that, go do that. You can find wherever your heart lies, wherever your passion is at, go do it. You see what I'm saying? And they say that RNs, and RNs because I could make more. You could make more as a social worker, but it all just depends on what you do. I know plenty of RNs that make tons of money because they travel, or they have a work from home job, or they're like, being an RN is so versatile. There's so many things that you could do. So, I mean, like I said, in the end, it all just depends on what you want to do. If you want to go to school for social work, cool. And social work, you can actually branch out and do those different things as well. I have a friend who specializes in sexual trauma as a social worker, so in the end, you do you. But shout out to all 50 of y'all that are in here listening to me run my mouth. My name is Kevin. I go by the Boot Nurse. Make sure you guys follow me. Make sure you guys share. Hey, I want all the shares. All of them. At least 10, because I need people to know how annoying and how great this damn TikTok live. Hey, I need 10,000 people to be my friend and follow me, because doing this off this phone and putting this thing, that's ghetto. You know what I'm saying? We ain't look. All right. You know what? I'm literally sometimes just gonna start doing stuff that Jordan, the guy who does he's like the president of the Fast Foods Club. I know all y'all on TikTok, and y'all know who I'm talking about. I'm literally just gonna be like, hey, come here. We need to fix that. I need 10,000 followers so I can stop streaming off my phone, and so y'all can see the questions a lot more clear. Because we don't got to be ghetto like that. You know what I'm saying? We can do better. We can do better for ourselves. You know what I'm saying? But shout out to y'all. But yeah, what questions do you guys have? I want to know who you are, where you're from, where you're at in your nursing journey. Are you a brand new nurse? Are you in your prereqs? Did you just now say to yourself today, like, man, you know what? I want to be a nurse. Or have you been a nurse for a while? What do you specialize in? What do you want to specialize in? What questions you guys have? Drop them down in the comments. My co-hosts are not here yet. As a matter of fact, one of my co-hosts is about to be mad because I didn't let her know I was on here. And I'm pretty sure she's probably out just doing stuff with her kids, today. So when she gets in here, I'll introduce her, and we'll talk about that. So and also for all the brand new nurses, if you started school this week, next week, and here in the next couple of weeks, and you want to get a jump on your NCLEX review, make sure you guys check out the 7-day NCLEX course. That link is in my bio. Go to the link tree and you'll find a 7-day NCLEX course. It's going for $48, 80% off of the current price. And once you get it forever. It's in its pre-launch phase. And so we're updating stuff all the time. So make sure you guys go over there and check that out. Okay. So where we at? What we doing? Who are you? Let me know what's up. Mariposa said, not money, more of a difference. Social work is more direct patient help, and RN is paperwork. Who the hell told you that? Who the hell told you that RN is just paperwork? I'm telling you, like, my entire career has been patient care. I'm pretty sure that's backwards. It's social work that does more of the paperwork, and RNs that do patient care. Hey, don't be coming up in here doing that. You about to get me triggered today. I'm from South Carolina, and I've been an RN for about 13 years, and I work for the federal government. Oh, you must work for the VA in South Carolina, probably in Columbia, huh? Yeah. Mm-hmm. Bella said, I'm in my second semester, just finished pharm. By the grace of God, I passed. I'm just saying, hey, it's you and God that got you through that, because pharm is probably one of the hardest sections to learn, and it's the second largest section on your licensing exam. So how long do you recommend studying? I usually tell people to study anywhere from 6 to 8 weeks. But it all just depends on what you have going on personally, how well you absorb knowledge, so on and so forth. I One thing I will recommend is to not go longer than 90 days, because if you're trying to study longer than 90 days, by that point, it's like you're not gonna be retaining, and at that point you're kind of just pushing your test or your exam. So I would recommend, and I would say anywhere from 6 to 8 weeks, depending on you. I've coached people that have passed in 4 weeks. Hell, I've coached people that have passed in 2 weeks, right out of school. So it all just depends. Currently in med surg and mental health. Shout out to you, Bella. I was about to say what? What'd I say? Turns out I was about to ask her who told her that. Yeah, exactly. Like, that's definitely backwards. Scrub tech here, and I just started RN school, working in labor and delivery now. Also, you must, who is that? Is that Rel? Uh, I used to be a surge tech. I was actually a surge tech instructor, actually. And I was a surge tech instructor for about 3.5 years. And I worked in labor and delivery doing nothing but, C-sections, doing C-sections in my sleep. I work in Florence Outpatient Clinic, but it's part of the. Okay, all right. Any traveling nurses need to rent? I got you in North Carolina. All right, cool. Oh, Nurse Cass is here. Shout out to one of my co-hosts here, Nurse Cass. Uh, I usually would put on like Nuck If You Buck, because she's all about them hands, and if y'all want to see her, y'all could just go fight her, because I mean that's just what she talks about. But no, Nurse Cass been a nurse 17 years, worked in corrections and psych, loving her life. So she said, try Jesus and not her. And yeah, so there's that. Is it? I don't even. I don't know how to say your name. I'm gonna mess it up. So is it Sorber? I'm gonna say Sorber. Will I pass my RN test? I failed twice. I don't know. Will you? Will you pass your RN test? I feel like that's a kind of a broad statement. Like, you can give me a little bit more context. And you passing your exam 100% is all on you. So that's what I'm gonna say. I'm Crystal from Connecticut, currently a scrub tech on the labor and delivery floor, going to nursing. Shout out to you, Crystal. Shout out to all my scrub. Like, this is the most scrub techs I think I've had anytime, like, at all. So, hey, as someone who is still currently a surge tech, of course, haven't worked as a surge tech since before I started nursing school. Shout out to y'all. I got a lot of love for my surge techs. Like I said, because I used to be an instructor. I deployed as a surgical tech in Afghanistan in 2012 and 13. So I got a lot of love for my scrub techs. So shout out to all y'all. Shout out to all 29 of y'all in here that are listening to me run my mouth. Right. So today we're going to go over some NCLEX questions. Like I said, we were talking about pharmacology last time. On Friday, we had a really good turnout. Had so many people share. Had so many people like people were loving everything about it. So somebody asked, "Hey, can we do pharm?" And I was like, "Sure, I got you." So I found some pharm NCLEX questions, and we're gonna go through them. All right, so we're gonna look at them so y'all can see what's up. Pharm makes me sweat. Look, is it Rel? Like, I'm just gonna say, okay, Rel. Me too. So that's why, like, you see me, I'm kind of sitting like this on my armpits, because it's just like, why do you make me feel so uncomfortable? You know what I'm saying? So trust me, I get it. Pharmacology was the hardest section, one of two hardest sections, but the hardest of the two for me to grasp in regards when I was studying for my exam. So remember, pharmacology, if you know your family name, you know your suffixes, your signs and symptoms. Once you learn how the hierarchy actually rolls for pharmacology, like, it's like you can't. I feel like it's impossible for you to get them wrong. So, like, if I start throwing out cardiac medications, okay, what are cardiac medications? And we start talking about freaking what? What do we start talking about? We start talking about ARBs. We start talking about ACE inhibitors, beta blockers, calcium channel blockers, all those stuff, right? So then you realize that most of them have the same signs and symptoms, right? Like, they lower blood pressure, or they increase heart rate, or they increase blood pressure. Some are inotropes. Like, what do those do? Like, chronotropes. Like, what do those do? So, like, once you figure those out, in the end, it's all about nurse safety. You know what I mean? LOL for beta blockers. Oh, I thought you was laughing at me, Rochelle. I thought you was trying to be funny. Don't be funny today on Labor Day, okay? I'm just saying. You're gonna get the finger today. Nursing school newbie here, 3 weeks in. Shout out to you, Masterpiece. Masterpiece, didn't you say that last time? No, wait a minute. You were in Nurse Sam's. TikTok live yesterday. Was it yesterday? You don't want the finger today? All right, cool. You won't get the finger today. Don't act up and you won't get the finger, Rochelle. All right? Yeah, that's why I thought. That's why I thought your name looked familiar. What's up, Victoria? How are you? I remember Victoria was in one of the lives before. I believe you were in one of the lives before, and you were super active, right? So, yeah, I was gonna do some nursing news and stuff like that, but we ain't gonna worry about that because that's not what y'all here for. Y'all already know what y'all are here for. We gonna get this thing set up. We gonna get this thing rolling. Make sure you guys smash that like button. Make sure you guys share because the moment that I do this, people gonna start flooding in. So utilize all my resources. That's what I'm talking about. Utilize all your resources. This is my first time. This is your first time. Well, welcome because it's about to go down with these questions. All right. So you already know how it is. We're gonna go through the rules. We're gonna talk about whatever we talk about, and we're about to get it on and popping. All right. I'm kind of funny, sort of. Not really. Whatever. But we're about to have a good time. So let's check it out. I'm about to move this. Like I said, this is ghetto. This is ghetto. Hold on. I gotta get this thing taken care of. I don't need none of y'all telling me I look like Jason Derulo either. Okay, don't be doing that to me today. Girl, you the one. Oh, and by the way, if you guys hear my son, I don't know what his problem is. Terrible. He's a turd. He's at that time where he's just a turd. I'm just keeping it all the way real. All right, here we go. And boom. All right, cool. Let's get this set up. Oh man. All right, here we go. See what we got. All right, cool. I think everybody can see that. Hey, give me a thumbs up and like give me like a million likes if you guys can see that. Let me know. Hey, because we're gonna be going through these fast. We're gonna go through these super duper duper fast. That's what we finna do today. Victoria said, "Kids always acting up when they always do. They always do. I don't even know what his problem is. He don't pay no bills. He just be acting like he just be acting out of pocket. He's probably gonna start screaming again. And I apologize if he does. So, all right, cool. So people can see it. Gucci. That's what I'm talking about. Hey, make sure you guys share this because I'm just saying. All right. Y'all already know what the deal is. We're going over pharmacology NCLEX questions. Number one, participate. Like I said, I'm kind of sort of, not really, but really, really funny. Rochelle, you better let them know what's up. Our poor best friends. Look, I'm just trying to let y'all know what's up. Hey, I just want to let y'all know the more you like and you give me gifts, I mean, you don't have to give me gifts, but I put that in there anyway. But the more you like, the more you give me gifts, the more questions that you get. But whatever you do, you boo. Got 25 questions total. So guess what that means? Y'all got to dish out 25,000 plus a million freaking likes. You already know what the deal is. I will talk about my course, the 7-day NCLEX course, and that link is in my bio. All right. It is in its pre-launch phase, and by me saying that it's in the pre-launch phase, meaning it gets updated every 2 weeks, 2 to 4 weeks with content. Right now, we're working on new generation NCLEX material, which is hopefully should be back here in the next 2 weeks. And we're working with a bunch of stuff, getting some stuff going. Look, it's about to be on and popping. Okay. I'm super excited about all that stuff. But hey, you can check that out. Links in the bio. $48. Once you get it, you have it forever. So my people that are going for RN and you got 2 years and you just started, go get it. Or if you're an LPN, it's the same material. So here's another thing I'm gonna tell you. When you go to LPN school, LPNs and RNs have the same content material. The biggest difference is you need to know your role about what you do. That's what the issue is. You need to know what you can and can't do. You need to know what you can accept and what you can't accept. You need to know what your roles and your responsibilities are. Okay, that's the biggest difference between LPN and RN, and my program helps with that as well. Okay, so yeah, I'll talk about 7-day NCLEX course. There's all that. All right, if you troll my chat, I'm gonna troll you, and then I'm probably gonna say some just off the wall stupid shit to you, and then I'm gonna give you a 600. A 600, you're asking, what the hell is that? A 600 is 600 seconds. 600 seconds equals 10 minutes, and 10 minutes is how long I'm going to ban you. But in reality, I'm going to ban you forever. So come in my chat, act a fool, you're getting a 600. I just like saying 600 because it's just like, it's unique. I got it from one of my favorite YouTubers. So yeah, act up, you're getting a 600. Oh, and also, I don't do gatekeeping. Like some people were just like, oh, like, where did you get these questions, blah, blah, blah. It says right there, nurselabs.com. Hey, if you're a brand new nurse and you're trying to figure out those NANDAs, nursing diagnosis, all that good jazz, boom, there it is. Like that, this is a great website in regards to looking for all of that information. All right. Joanna said, "Oh my God, Kevin, been waiting for you to go live. So excited to see you live again. You're 86 from the." Shout out to you, Joanna. Look, you already know when I go live. You already know what's up. My thumb up. My thumb is tapping. Hey, tap it. Tap it. I want carpal tunnel and all them phalanges. I want them all in there. All right, cool. I think that the rules have pretty much been set. I think we all know what the deal is. Okay, that's more in focus. I think we can roll. Let's check it out. We're gonna go to the first question. All right. Everybody can see that. Doesn't look so ghetto. I know what I'm talking about. All right. So the first question is, a 2-year-old child is receiving TPN through a central venous line. This is the first day of TPN therapy. Although all of the following nursing actions must be included in the plan of care for this child, which one would be a priority at this time? Is it use aseptic technique when changing the dressing, maintain central line catheter integrity, monitor glucose levels, or check liver function tests? Co says C, Bella says C, Gabriel says C, Rochelle says C. Well, Rochelle might change her mind, but whatever. Gabriel already said C. I saw that. Lily says C. Okay, cool. All right. Hey, there's one thing I always like to tell people is that if you have a thought, psych, if usually your first answer is the correct answer 9 times out of 10. Okay. Usually the first answer. Now let's think about this. You have a patient that's getting TPN. Like, think about what TPN is, like the banana bag, as they call it, right? And it's going through a central venous line. So there's so many little key things in this question that can show you like what you can and can't do and what you're supposed to do first. So think about, what is TPN, right? And you guys can answer this question. What is TPN? Like, what is it composed of? What is its compounds? What is the central venous line? Who can access this, right? And then it says, what is the priority at this time? What is TPN once administered? What is that going to do? What am I going to be looking for? Masterpiece says A, aseptic technique, right? Aseptic technique during dressing change. And here's another thing. LPNs, can you do anything with and my people going to LPN, can you do anything with a central line? Central venous access device or central line. Can you do anything with it? My guess was A, but I picked C, guessing all the way. Okay, I'd rather you guess. Bella says no. Lily says no. Exactly. You cannot do anything with a central line, right? Okay. All right. So based off of that, who said that? Jazzy says B. Maintain central line catheter integrity. Okay. And then you got to think about where is the central line going? Are those only RN questions? Is it Tasia? It's Tasia. I'm going to say that. Tasia. So these are RN questions. However, you don't have to be an RN to know what is supposed to happen here, right? And that's another thing that I try to tell people is like, although that the questions may not be directly towards LPN, there are things that you need. There's things, because this is a pharmacology question because TPN is part of pharmacology, right? So C, since TPN can cause hyperglycemia? Question mark? I don't know, Steph. You tell me. I'm doing fundamentals now in MedSurg lab, so I'm guessing. Okay. All right, cool. I think we got a general consensus on a bunch of people picked C, a bunch of people picked, a few people picked D, some picked B, so we're kind of all over the place. C due to TPN having high sugar concentration. Okay. C cause hyperglycemia. Okay, well, let's see what the answer is in 3, 2. So the answer is C, monitor glucose or serum glucose levels. So you want hyperglycemia may occur during the first day or two as the child adapts to the high glucose load of TPN solution. Thus, a chief nursing responsibility is a blood glucose testing. So here's the thing, as an LPN, can you do glucometer checks? Do you see how this can be tailored to an LPN as well? Exactly. It could be tailored to an LPN as well. I could rewrite this question and say, hey, like who can check the glucometer, right? Just because they're on a central line doesn't mean that you can't, do a glucometer check, right? So TPN, also known as parenteral nutrition, is a form of nutritional support given completely via the bloodstream intravenously with an IV pump. It administers protein, carbohydrates, fats, vitamins, and minerals. It aims to prevent and store nutritional deficits, allowing bowel rest while supplying adequate caloric intake and essential nutrients and removing antigenic mucosal stimuli. Okay. So here's another thing, and I know because Masterpiece was asking is anytime that you do a question, anytime you do a question, you need to review it. Like you need to read your answer, read the rationale of why the answer was correct, but you also need to read the incorrect or why these are incorrect. Okay, we're not going to do the incorrect ones right now because then I'd be on live for like hours, and I got kids, and we can't be doing all that. Yeah, I think we're good on that one. All right, let's check out the next one. Hey, shout out to all of y'all. We're going on to question 2. Nurse Jamie is administering the initial total parenteral nutrition solution to a client. Right. So notice, and based off of this question, Nurse Jamie is administering the initial is administering the initial. So this person is administering the first one. So I already know this is an RN question, right? So which of the following assessment requires the nurse's immediate action? Is it temperature of 37.5 degrees Celsius, urinary output 300 mLs or cc's, they both mean the same thing, in 4 hours, or skin turgor or glucose of 350. Now look at that. Look at that. First question's already talking about TPN. And now you get another question that's talking about TPN. Don't be surprised if you were taking your NCLEX that you would have something pop up like that. Okay? Everybody saying D. Jazzy saying B. Marty saying D. Jazzy's claw collection. Jazzy, you make nails? You make fingernail? No, honey, not your finger, do I? All right, I'm done. Oh my God. D. Masterpiece. I'm gonna need for you to do something for me. Don't put question marks. Just go with your gut feeling. And guess what? If you get it wrong, it's okay. It's okay if you get it wrong. Because this is what this is for. To train your mind. Okay? I'm going to go with D related to the first question. Okay? D. C, you're at risk for they're at risk for dehydration. Okay? What else we got? Okay, thank you, and you're right. Yep. Go with your feeling, right? Because 9 times out of 10, your first answer is probably right. But if you don't know, this is why you study. Get into a regimen of doing it, okay? All right. So had some general. Looks like everybody. Some people said C. Some people said D. So I think we're good. We'll go on D because again, high glucose or high sugar equals hyperglycemia equals trouble. Yeah. What happened? Hey, so what happens if you have if you go into hyperglycemia? What happens if you have hyperglycemia? What could that lead to? This has nothing to do with this question, by the way. Okay. Well, yeah, death, Steph. Come on. But what other there you go. There you go. Somebody said it. DKA. Diabetic ketoacidosis. Yes, ketones. There you go. There you go. Poor skin turgor means dehydration though, right? Correct. That's exactly what that means. So I'm going to answer this question right now. Hey, best way to study pathophysiology. Open the book. No, I'm just kidding. Honestly, YouTube. Usually sugar is over 600. It depends on the literature that you're reading. Some people say DKA is over 300, over 400. It all just depends. So, but usually when they on NCLEX, when they give you something in regards to DKA, they're going to give you all of the other issues that come with DKA besides a high glucose. Does that make sense? All right. So the answer was the high glucose. And it says TPN formulas contain dextrose in concentration of 10% or greater to supply 20% to 50% of total calories. Blood glucose levels should be checked every 4 to 6 hours. A sliding scale dose of insulin may be ordered to maintain the blood glucose level below 200. Okay. All right, that looks good. That looks good. That looks good. Y'all are getting them. Y'all are getting them. Hey, we got a good amount. We got a good amount over here. Hypoglycemia leads to shock, immediately needs insulin and fluids. Hypoglycemia? Hypoglycemia. So what does insulin do? Now we're talking about endocrinology, right? So what does insulin do? What does it do to your blood sugar? Does it raise it or does it lower it? Yeah, with insulin it drops, right? Is it Deja? And this isn't me picking at you, but this is what just stuck out of my head, right? Lower than, oh my God, not insulin for hypo. Yeah. So hear me out. Listen up. Check me out now. Now, this isn't to poke fun at you, but some people don't remember. Some people don't know that, and some people don't remember. So if you have hypoglycemia, which means you have a blood glucose level lower than 70, lower than 60, depends on what literature you're looking at. What are the ways to bring the patient's blood sugar up? What if they're conscious? What do you want to give them? Rapidly metabolizable carbohydrates, such as like could be candy, could be milk, could be juice, could be turkey, could be something, right? Something that's going to rapidly metabolize, right? Now, if they're unconscious, you could give them glucagon. If they have IV access, you could give them what is it, D50, right? You could give them, yep, glucagon. You can give them D50, right? So remember, insulin lowers your blood sugar, right? While when you eat carbohydrates, it brings it up. D5, I mean, it does. I mean, it does have the compounds to bring your glucose levels up. But most places, when they're in hypoglycemia, well, at least me, I worked as an ICU nurse. And that's another thing. If you guys are new here, I worked as an ICU nurse for a little over a year. I've been a nurse for 3 years. I worked in the ICU, I worked in PACU, and I worked in the operating room. So somebody comes on here like, hey, what are your qualifications? I'm like, hey, bro, you should have got here earlier and you should have listened to me. No, but but yeah. So I've only given D50, and I'm telling you, it's like pushing sugar, pure sap from a tree through an IV. It's wild. I'm trying to tell y'all. So yeah, there's that. But just remember, because endocrinology can be thrown into management of care, because remember, the NCLEX is all about safety, right? It's all about when you can and can't do something. Is it safe? When you should hold something? When you need to inform the doctor? So on and so forth. All right. All right. Next question. I'll sit here and I'll run my mouth, and I ain't trying to do all that. I want y'all to get this knowledge in. Okay. Nurse Susan administers IV gamma, was it globulin to an 18-month-old with AIDS. The parents ask why this medication is given. What is the nurse's best response? Now, what kind of question is this? What kind of question is this? And remember, with pediatrics, you have two patients. You have the patient and you have the parents, right? So what type of question is this? This is a good, it starts with a T. There you go. Therapeutic response. There you go, right? Because anytime you see anything in quotes, oh, I'm sorry. Yeah, in quotes. I'm about to say parentheses, but I would look like a fool if I would have said that. Anytime you would have said anything in quotes, you already know that this is going to be you want to have a good therapeutic communication response, right? So the first one is like, I will slow down it will slow down the replication of the virus. This medication will improve your child's overall health status. This medication is used to prevent bacterial infections. It will increase the effectiveness of the other medications your child receives. We say D. Some people say A or D. So now, even though it's in quotes and you want to have a good therapeutic response, this is telling you, well, I want to know, what does gamma globulin do? Like, what is it and what does it do? Okay. So we say A, it'll slow down the replication of the virus. B, we give IgG on my unit. Why you put a question mark then? If you say y'all give it on your unit, huh? Make it make sense. Hey, shout out to all y'all. Shout out to all 200 plus of y'all in here. I know y'all only come in here. Y'all only come in here just for the questions. Y'all don't love me. Make sure you guys share and follow me. Okay. Yeah. So we got some D's. We got some A. Throw some D's on it. All right. So we got some A's. What else we got? A for sure. Okay, Alyssa. Okay. All right. Got Ali says D. Melissa says D. Amanda says A. Potty Mouth says A. Rochelle says C. It does prevent infections. Okay. Okay. D. Masterpiece says D. D. I've taken the NCLEX and still second guess myself. Well, same. No, most of it. Here's the thing. Hey, also, you guys got to remember is that the NCLEX is based off of like a 0 to 100 scale. And all you need to do is just do a little bit better than half or a little bit better. So essentially, you need to get a 50% or above. What are the tests you know that you need to get a 50% to pass, let alone get 50% and get a license? My gut says C. All right. Well, if your gut says C, I would pick C then, if that's what you want. All right. Are these PDFs or where can I find them? Nurselabs.com. I don't gatekeep. Some people were just like, hey, if you got the blah, blah, blah. And I was like, hey, bro, chill the fuck out. Okay. Relax. So if next gen is at least 60% passing line, say what? Oh, so for next gen is at least, no, it's the same. So so the only thing that's changed In regards to the NCLEX, hey, how about, hey, Sarah, if you're going to ask for an answer, how about you put a smiley face at that? How about you guys say like a LOL? How about you guys do that? Yeah, how about that? All right, so it's C. The medication is used to prevent bacterial infections. Is it A? It is not A, it is C. IV gamma globulin is given to help prevent as well as fight bacterial infections in young children with AIDS. What is it? Gamma globulin injections seem to lower the number of certain infections among children with AIDS, but does not cure the lethal ailment. Okay. See, gut, trust my gut. Yep, trust it because you were right. You were right the whole time. Tomorrow's my first day of school for a nursing degree, and I'm scared for this day. Well, don't be scared for this day. You've been preparing for this day. You did the prereqs, you did the entrance exam, you did whatever volunteering that you did. You did all that. People are passing more with the next gen than the older one. They are. They are 100%. So because the next gen questions are more relevant because they're giving you all the information that you need. Here's the biggest thing about the next gen NCLEX is that it wants to know your critical thinking and your critical thinking and clinical judgment skills. And those like people are just like, I don't like the case studies. You can get 6 to 8 questions out of a case study. Y'all understand what I'm saying? And they give you everything you need. They give you the history, the vitals, the laboratory trends. Like some of the answer choices are like they're easy. Like they have the drop down, like where you have to get both of them right. Like you're kind of like filling in the blank type deal. You know what I'm saying? So look, did you use Kaplan? Who said that? Steph. Yes, I did use Kaplan. I used Kaplan. I used Mark Klimek. I liked Kaplan and Mark Klimek a lot because it helped me. It helped me out a lot. Kaplan is what I guess people would consider the premium. I used Archer, stay with one program, and just use that. I would agree. There's so many people that would use Archer, use UWorld, use Simple Nursing, NCLEX High Yield, Kaplan. I mean, there's so much. There's so much that people would use. Find you one. I use Mark Klimek as audio, and then I use Kaplan as freaking as like doing my questions and all that other good stuff. So I passed 1 month with Mark Klimek. Shout out to you, Macy. And they do partial credit. Yep, they sure do. Mark K and Archer for questions. So here's another thing I'm gonna tell y'all is that the way that you learn is not the same way that other people learn. But everybody will be taking an NCLEX on the computer. Okay, so just letting y'all know that. Now we're talking about another TPN question. When caring for a patient with TPN, what is the most important action on this part of the nurse? Right? What does it say? Record the number of stools per day. Maintain strict I's and O's. Sterile technique for dressing changes at IV site or monitor for cardiac arrhythmias. B b b b b b b b b b. Always report any questions you have. A nurse to the MD. Nurses should only make TikToks. Robbie, what the fuck are you talking about? I don't even know. I don't know what that means. I'm confused. Like we're just going over questions, my guy, or my girl, or whoever you are. Hey, don't get a 600. Don't come up here and acting a fool. Anyways, so what are we thinking? We got B's, we got A's, we got C's. Uh, Give him the finger. Who am I giving the finger? Hey, he about to get a 600. I mean, if y'all want me to give him a 600, y'all can answer the question and also type in 600. I'll leave it up. This is a democracy. Robbie, read the room. Throw some bees on that. Y'all wild out here. Y'all wild out here. All right. So what are we thinking? What are we thinking? What are we thinking? All right. All right. It's 100% C. Okay. D, C, C, B, 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 B. All right. Cool. C. All right. You guys are all over the we wild and 600 and tell him to sit down. Oh, he already got that 600. You already know I don't play that game. You really got to read the room. There's hashtags and we're talking about NCLEX style questions. So like, come on, bro. Like I'm not the one. All right. The last question just said to be sterile. Got B. Got B. Hey, yeah, y'all give me 1,000 likes for the fact that I just gave this dude a 600. That makes me happy. All right, here we go. All right, we're going to get to the answer. Here we're going to get to the answer. So the answer is sterile technique for dressing change at IV site. Clients. Now think about it. Where were we? No, it doesn't say that. So I'm not even going to say that. I'm not going to do that. So Clients receive TPN are very susceptible to infection. The concentrated glucose solution are a good medium for bacterial growth. Strict sterile technique is crucial in preventing infection at the IV infusion site. Catheter-related sepsis, which is a very real thing, rates by decrease since the introduction of the guidelines that emphasize sterile technique for catheter insertion and skin care around the insertion site. Right. So TPN is usually given through what? What's the site? What are the lines? Does this go? No, this is not on all IVs. Not only on through IVs. Central lines, right? Yep. Goes through central lines, right? So remember, central lines, where do they go? Where do those central lines go? Because it's a vesicant. It goes to the heart. That's right, Lily. So let's ask this question. If you don't have any type of sterile technique when you're taking care of a central venous access device that goes all the way from point of entry to your heart, infection is just going to find its way up in there and be like, hey, bro, I'm here. Time to fuck some shit up and give you a heart attack. You know what I'm saying? So that's why sterile technique is so important when taking care of central venous access devices, right? And it's a vesicant, so it's really, really harsh on just normal vessels, because you want to put them in a big vessel, a little bit thicker than just putting it in a vein, okay? Because I like to think of vesicants as if you drank something spicy, because the vesicant is going to be real spicy when it goes into your veins because of how thin those walls are. Just like if you went to go swallow some hot sauce, it's just going to be spicy all the way down. So think of it, vesicant equals spicy. And that's why we put them in central venous access devices, okay? All right, on to the next one. All right, here we go. The nurse is administering an IV look at that. An IV vesicant chemotherapeutic agent to a client. Which assessment will require the nurse's immediate intervention? Hey, we need to do this right now. I need to stop what I'm doing and I need to do this right now. A, stomatitis lesion in the mouth. B, severe nausea and vomiting. C, complaining of pain at the site of infusion. Or D, a rash on the client's extremities. Got C. C's get degrees. Right. All right, C. All right, cool. I see y'all. C, F, really, Deja? Or is it Deja? C's get degrees. C's get degrees. Period. Are you sure? Deja? You said F a whole second ago. I just want to make sure. Brooke says B. Why is this actually a smart way to get your homework done? Because it is. I'm just saying. We sit here. Look. I do these every 3 days. 3 days out of the week. I might actually go down to 2, just because your boy be tired. Immediate action is B. Okay, masterpiece. All right. D. Okay, Deja, I got you. Got D. I think B. Got C. D. Pain is not emergent. Okay. Kaylee says C. All right, well, let's see what throw some C's up, really. All right, here we go. We'll check this answer in 3, 2. The answer is C. Complaints of pain at the site of infusion, right? So remember a vesicant. Remember, we just talked about a vesicant. So it's the compound of the medication that's being given that is essentially harsh to the vessels, right? And I literally had just said that before this question had even came up. And I didn't say that. I didn't say it because of this question. I just said it because people forget that's what TPN is. A vesicant is a chemotherapeutic agent capable of causing blistering of tissue and possible tissue necrosis if there is excavation or extravasation. I always fuck that word up. Always. Hey, look, I'm a nurse. I'm not a spelling bee champion or a word champion. All right. So these agents are irritants that can cause pain along the vein walls with or without inflammation. Okay. Like you better be worried about necrosis. That's right. because it will tear that arm up. Hey, so anybody like you can always just Google what somebody like that has like an infiltration of a vesicant and see what it looks like. So it says it understands, but B was severe nausea and vomiting. All right, well, cool. Let's look. Hey, so this is another thing, right? So what did I say? We get the answer. We read the rationale on why the answer is right, right? But then we read the answers, or we read the answer choices that were incorrect with their rationales. This is what you are going to do when you are studying. Okay. So who said something about B? Let's see. So nausea and vomiting can start within the first few hours after chemotherapy drugs are given. So what does that say? So it says, however, nausea and vomiting may start more than 24 hours after treatment and several days afterwards, right? So that's, to me, that's expected to happen when somebody's on chemotherapy. Okay. The rationale makes it seem like it was regular nausea and vomiting when the answer said severe. You're right. You are correct. But remember, even though it says severe, it says that that nausea and vomiting can start. So that tells me that's an expected outcome. Or I'm sorry, that's expected, like an expected side effect of somebody who's on chemotherapy. And remember, you don't have to agree with it, because trust me, there's going to be questions out there that you're going to be like, bro, how in the hell is that right? So it says, love this. Yeah, that's how I interpret it. Okay, what QBank is this? FTM is through, who is this through? Oh my God, nurselabs.com. All right, cool. So we're good on that one. Hey, well, check that out. We're at a break. Hey, so every 5 questions, y'all are going to get this. So shout out to all 250 people that are in here. Hey, if you are new here, my name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys share this. Make sure you guys go over to YouTube, Instagram, X. What's another one? Thread. Make sure you guys go over there and follow me. Hey, sometimes I say some really funny stuff. Hey, biggest thing I want for y'all to do is to participate up in here. I need answers. I want y'all to participate. I also want you guys to answer each other's questions. Look, there's 263 of y'all, and there's one of a glorious old me. Okay. So I need for you guys to make sure that you guys are participating, but also answer each other's questions, because I may not be able to see them. Okay. The more you like or give a gift, I put gift on there just because, but the more you like, the more question that you get. So, whatever. Do you, boo? Do you? Got 25 questions total. So guess how many likes you got to give me? Yes, a million, a whole bunch of millions. I'm just saying. Also, I need 10,000 followers so I can stream this on the computer, because, streaming on the computer, doing this right here is ghetto. You understand what I'm saying? It is ghetto. I'm cool with it. But it's ghetto. Okay. I'm running up your light. Hey, run them up. So, yeah, my course, the 7-day NCLEX course. It is in its pre-launch phase. The link is in my bio. Go into my link tree. Once you see it, you'll see all that glorious stuff in there. So make sure you guys check that out. It's $40. I'm sorry, it's $48. It's 80% off its current price right now. Once you get it forever. And right now we're updating content that's going in there, and also working on new generation, or the next generation NCLEX PowerPoints, videos, and as well as working on NGN questions that are going to be going in there. So I'm just saying, if you're a new nurse and you just started school this week or next week or in the next month, and you don't graduate for another 6 months to a year to 2 years, who's to say? What other person could you just be like, look, I got it for $48 and I get it. You get it updated the whole way. All right. So make sure you guys check that out. Now, if you troll in my chat, I'm going to troll you back, and then you get a 600. I literally gave somebody a 600 today. We already know what's up. And a 600 equals 600 seconds. 600 seconds means 10 minutes. 10 minutes is how long I'm going to ban you. But I'm just going to ban you forever. I just like saying 600 because I got it from one of my YouTubes, okay? One of my YouTube people that I follow. Also, I don't gatekeep, like, at all. Some people are just like, oh, why are you holding out on the questions? I'm like, bro, I'm not holding out on the questions. Chill out. And they ain't even all that serious, right? But nurseslabs.com, that's where I got them. So all the new nurses that are just starting out, when you guys start learning about nursing diagnosis and all that other good jazz, Nurses Labs, look, just saying, they help me with my NANDAs. I'm just letting y'all know. What's up. Hey, but if you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. Taking NCLEX, or you're a brand new nursing student trying to get a jump on something, let us know what it is. Yes, it's free. Go to nurselab.com and it's free. Let's do questions. Hold on, I'm trying to read answers. Y'all better stop being impatient. What's wrong with y'all? Y'all act like I gotta go to work tomorrow. Which year say 600? I want to know. I already said it, Joanna. What you mean? What you mean? What you mean? What you mean? Ask your question again because I think your letters were all messed up. All right, cool. So now we got that all out of the way. Let us go to the next question. Victoria said, I'm a CNA. Take my T's before I can apply. Shout out to you. Say it again. I done said it already. People don't be listening to me. 600. Hey, 600 means you go in the band world, okay? Been an LPN for 8 years. Shout out to you, Angel. Precious, Ohio, in my third semester LPN program. Shout out to you. I'm Elaine. I'm in my third semester at Kaiser in Fort Myers, Florida. Shout out to you. Hope everything was safe with that hurricane that ran through. Cassie from Philly got accepted my LPN program, the LPN school 3 days ago. Shout out to you, Cass. Which YouTuber says 600 like you said? Oh, his name is the Black Hokage. So anybody that's an anime head or anime fan, you already know what a Hokage is and what show it's from. Second semester, senior in nursing school. Any advice? Don't stop and keep going. I failed NCLEX twice. Oh, that's another thing, y'all. I failed my NCLEX 3 times. Three. But y'all would have never known that until I said something. Look at that. And we'll talk about that when we get to the next break. All right, BSN, 6-month NCLEX. Shout out to you. All right, everybody's already answering them. I'm going to read the question anyway. Nurse Celine is caring for a client with clinical depression who is receiving an MAO inhibitor, right? Talking about psych meds, right? When providing instructions about precautions with this medication, the nurse should instruct the client to what? A, avoid chocolate and cheese. B, take frequent naps, which is something I want to do all the time. C, take the medication with milk. Or D, avoid walking without assistance. Emma says, no tyramine. It says A. Edmund says, I forgot what she said. It already scrolled. A. Dodger says A. Stack Girl says D. Mona says D. Did that not Mona? It says Monroe the Stallion. Is that what it says? I'm Yvonne, studying now for my exit exam and got NCLEX actor. Shout out to you, Yvonne. Shout out to you. Precious says A. I failed mine 3 times also. I failed 3 times and passed on the 4th. Just like Coach Prime talks about. Hey, I believe. And I made that shit happen. I'm just keeping it all the way real. All right, so people are all over the place. You guys are answering. All right, I love it. I love how you guys are answering. So let us go and let us see what the correct answer is. What's wrong with sugar and dairy? I'm lactose intolerant, I guess. Oh, you're asking me? I don't even know who you're asking, but I'm going to answer this question anyway. So the answer is A. You're going to avoid chocolate and cheese. Just like, who was it? I think it was Emma who had said that, right? It says foods high in... Is that look, whoever my pharmacy tech is, hey, look, I'm gonna need for you to say that word for me. I'm just gonna say, was it tryptophan? Duh. Tryptophan, tyramine, and caffeine, such as chocolate and cheese, may precipitate hypertension crises. Tyramine is an amino acid that helps regulate blood pressure, right? So if I'm taking an MAO inhibitor and then I eat chocolate and cheese, it's gonna make my blood pressure go through the roof and cause me to have a hypertensive crisis. And I ain't trying to, stroke out anywhere. It occurs naturally in the body, and it's found in certain foods. Medications called MAO inhibitors block, a monoamine oxidase, which is an enzyme that breaks down excess tyramine in the body. Blocking these enzymes helps relieve depression. Yeah, they're not really given. MAO inhibitors are kind of one of those things that are rarely given, but they still have to go through them because there's a lot of places that still give them. Drugs are a Band-Aid. Oftentimes, mold exposure is a source of psychiatric disorders. Okay. I'm going to need for you to put a smiley face after you say next question because we ain't on your time. We on mine. The hell? What you think this is? Shout out to all 131 of y'all. Shout out to all 131 of y'all. Everybody got this? All right, cool. We're going to the next question. Oh, am I breaking up? My bad. All right. Second year pharmacy student here. Shout out to you, Olivia. Shout out to all the pharmacy folks. Question number 7. While providing home care to a client with congestive heart failure. All right, now paint the picture. Patient has congestive heart failure. Let's start to think about what that patient would look like. The nurse is asked how long diuretics must be taken. The best response to this client should be what? So if I could say one thing that would be safe and leave to this patient, what would it be? As you urinate more, you will need less medication to control fluid. Is it B? You will have to take this medication for about a year. Is it C? The medication must be continued so the fluid problem is controlled. Is it D? Please talk to your physician about medication and treatments. We say C. Lactose is often not cool for lactose intolerance. Okay. C. I enjoy cardiac. Okay. Okay. Got some C's because C's are getting these degrees, baby. That's what I'm talking about. All right. Chelsea says C. It says C. C. Reese says C. Okay. It looks like Edmund said D. Summer said D. Is it Bailey? Bailey Shea. Did I say that right? Bailey Shea says D. MS says, I have my clinicals on telly this semester. Ah, no wonder. There you go. You better get all these right then. Congested, what does it say? Heart failure, fluid overload. Yeah. Hence why he's talking about diuretics. That's right. All right. So a lot of people are saying C, had a few B's, no A's, which is cool. So let's check this out. Let's see what this answer is in 3, 2, and the answer is C. The medication must be continued so the fluid problem is controlled. So here's a question. Why is D incorrect? Why is D incorrect? That's right, Rochelle. We do educate patients. Shout out to you, Elaine. Got the answer right. D is not the answer because it is not a therapeutic response, right? Yep, you're supposed to educate. You are not giving info with D. So by me not answering this patient's question and saying, hey, talk to your doctor, what is that called? It's called what? What is it called? There's a specific term. Because you are providing the care. Of course you are. Of course we're providing the care. Because instead of you trying to answer the question, which would be C, you're trying to push the answer off to a physician, right? We're responsible for education, avoidance, or passing the buck, deflecting, right? I'm trying to pass that answer or pass that type of care off to somebody else. I'll ask your doctor. He'll tell you. I don't know. Right? So this is the most therapeutic response and gives the client accurate information. Diuretics are used to achieve and maintain euvolemia, which is patient's dry weight with the lowest possible dose. This means that the dose must be adjusted, particularly after the restoration of the dry body weight to avoid the risk of dehydration, which leads to hypotension and renal dysfunction. Oh, can you guys not hear me? What happened? Can you guys hear me? Oh, hold on. Let's see. We can hear you? All right, cool. Some people saying that they can't hear me. It's a little muffled. Maybe because I hit it. All right. What about now? Can you guys hear me now? Loud and clear? Sounds like the mic got muffled or underwater. Oh, man. I don't know what's going on there. Mic sounds muffled. Also maintain electrolytes, causes diuretics or potassium. Yep. I like where your head's at because by you speaking like that, you'll get it. Wow, what the hell is going on here? Check the mic plug. I don't have a mic plugged in. I'm on my phone. I tried to tell y'all this is ghetto and why I need 10,000 people to like me. Here, let me see something. All right. Lost connection. All right. I paused it. Like, can you guys, sometimes if the speaker's at the bottom of I don't have an iPhone. It's not muffled. Maybe your thumb. Look. Right here. Can you guys, hey, do I still sound muffled? Do I still sound muffled? Still sounds muffled. Oh, man. All right. You can hear me? I don't know what the deal is. Like, some people can hear me and some people can't. But we can hear you. You sound like you're in another room, but we can hear you. Okay, cool. All right, well, let me just go on then because it could be, you know what? It could be my stand. Let's see what's up. Let's see what's going on around her. All right, how about that? Does that sound better? Yes. All right, cool. Bet. Better now. Sweet. All right, let's check that out. All right, cool. All right, cool. Here we go. They were just like, please don't let them turn this live off. Please, I ain't got nothing else to do but NCLEX fucking questions today. Come on, stay with me. All right, I got you. Shout out to all. Hey, shout out for y'all for rocking with me. I got you. All right. So, George, age 8, is admitted with a rheumatic fever. Which clinical finding indicates to the nurse that George needs to continue taking salis? Oh my God, was it salicylates? He has received at home. Lord have mercy. Why in the world was that hard for me to say? Also needs to be on ASA. Okay. Was it A is chorea? A is polyarthritis. C is subcutaneous nodules, or D erythema marginatum. I stay fucking them up. Oh, I'm glad I sound better because I don't know what the deal was. Shout out to all y'all for likes. Hey, we're almost to 20,000 likes and we ain't even damn 10 questions. And I loving all that. Sally Silate, silly Sally. It says D. Lane says B. Look, I tried to tell you pharmacology is not my best. It's not like if I see it, I know it. Can I get an A plus for asking if you had a stand? Victoria, hey, you're right. You're right. You get an A plus. You know what? As a matter of fact, Victoria, you can pick Wednesday's NCLEX question topics. How about that? Because Victoria saved the day, y'all. Because I was about to turn the live off and just try to start it all over again. So I remember it was Kevin BSN. That's why I could find you. Oh, my bad. So I changed it yesterday because I'm trying to just update some stuff. So I just changed it yesterday. But I'm still Kevin. I still Kevin BSN RN. I ain't changed. Why I'm a CNA? I don't know. Look, you better look. You want these questions? You better look, or you better pass it off to somebody else. Oh, I read the wrong. It's B. Okay, bro, is yapping. Hey, if you don't like me yapping, you can go away. Hey, you can get a 600 too. Hey, look. Hey, I'll let the chat decide which I want me to do about this man who just like I'm yapping. If you don't like me yapping, bye. There's the answer right there. So the answer is B, polyarthritis. Oh, 600, say less because he's about to get one. Polyarthritis is characterized by swollen, painful, hot joints that respond to, what'd you say? Salicylates. Polyarthritis refers to a joint disease that involves at least 5 joints. One or more signs of inflammation, including pain, movement restriction, swelling, warmth, and redness, are seen in the joints involved. Okay. Mental health for Wednesday. All right, cool. We can look at some psych questions. We can look at some psych questions. We'll see what's up. Anybody? We'll roll on to the next one too. Let's see what's up. All right, cool. Question number 9. An order is written to start an IV on a 74-year-old client who is getting ready to go to the operating room for a total hip replacement, right? What gauge of catheter would best meet the needs of this client? What do we got? Mental health. 23. Wait, 23 is not it ain't even up there. See? 21 butterfly. Lily says 18. All right. So that's A. I'm assuming. How many questions is there and how long are you going to stay live? Right now, there are 20 questions. We got 20 questions. Cassie says 21. Got CBA 2018. Thank you, sir. I'm very grateful for your help. May I ask how many questions? Okay, yeah, I just said right now. It looks like we're doing 20. Got A, C, got A, B, 20. It's C, C. It's C. Cassie says it's C. All right, Cass. All right, A, B, B. Meredith, look, Meredith, you can only pick one. You can't pick both. 18, 100%. All right, Rochelle. Rochelle, I'm just gonna make you. I'm gonna make you co-instructor or something like that. Shout out to all 250 of y'all rocking with me. Hey, so we're doing NCLEX style questions. I appreciate you. Make sure you guys participate. Okay. Butterfly for the arm isn't okay. That question's already gone. How often do you do these lives? Is that Yvonne? I think it's Yvonne. I do them 3 times a week: Monday, Wednesday, Friday at 17:30 or 5:30 Central Standard Time, Texas time, because that's the only time that matters. I'm just kidding. All right, so here we go. Sasha. Oh, yo, hey. So shout out to Sasha. Sasha, hold on before I get yelled at because apparently I'm yapping. So let me go on to the answer. All right. So the answer is the 18 gauge. 18 gauge, right? Clients going to the operating room ideally should have an 18 gauge catheter. This is a large enough to handle blood products safely and to allow rapid administration of large fluid amounts of fluids if indicated during a perioperative period. An 18 gauge catheter is recommended. Every one of my patients, when I worked in the operating room as an OR nurse, has an 18 gauge. Sometimes they would have two, depending on whatever the anesthesia provider wanted. Okay. Yes, 20s can handle blood as well. However, per literature, not where you work, but per literature, the 18 gauge is the recommended gauge of catheter for blood transfusions. So in the operating room, you got to think so many things can go wrong. Okay. And the smaller the gauge, AKA the higher the number, is because we want to rapidly infuse this. We don't want it to go through a smaller catheter if that's what we have. 18 is a larger bore. Correct. It is a larger bore for transfusion. Correct. Yep. Absolutely. Shout out to y'all. Shout out to y'all. Hey, but shout out to Sasha. Sasha ain't been here a while because I'm pretty sure that I thought the hurricane took her away because she lives out there in Florida. But Sasha is one of my other co-hosts. She ain't been here in a while, and me and her are gonna talk about that. And yeah, Sasha works as a nurse, been a nurse for a while, so she's coming over here. Sasha, you already know the deal. We doing NCLEX style questions. So I done already gave two people 600s today, and I'm feeling Gucci about it. So shout out to all y'all. All right. So, you're welcome. I'm glad that you understood that, Gabriel. Hey, if you guys don't understand stuff, hey, make sure you guys ask it in the chat and you guys answer amongst each other because Rochelle's down there doing her thing. All right, cool. Question 10. A client with an acute exacerbation of rheumatoid arthritis is admitted to the hospital for treatment. Which drug used to treat clients with rheumatoid arthritis has both an anti-inflammatory and immunosuppressive effect? Which one? I ain't even reading them because I'm gonna mess them up. Yes, I had no power, and then I've been working. I've been working both off. I bet. Hey, at least you here though. At least you alive. You know what I'm saying? I don't know what A is. Golden sodium thiam something. So here's the thing: if you don't know, don't pick it. Same thing with select all that apply. If you don't know what that answer is, do not pick it. C is prednisone. Okay. Prednisone, C for inflammation. Okay, Lily. All right, Lily, I see you. Daniela says C. Okay. I am not in nursing school, but I have my PCT exam. Okay, anyone know any online practice testing sites? Maybe Nurse Labs has that too as well. I'm not sure. Is it Mama Crystal Champagne? It's C, not D, guys. Hey, Joanna, you can't be in here trying to change people's stuff. But hey, you do you. What is prine? I don't know what prine is. What is that? Is it brie or bray? Brie. I don't know. 100% C. Okay. The rat tail says C. Priscilla says C. Cool. So it looks like we're all over the place. Prednisone. Okay. If y'all chose any other letter than C, read it again. Okay. C. All right. Cool. We're about to do the answer in 3, 2. The answer is C. Prednisone. Prednisone is used to treat persons with acute exacerbation of rheumatoid arthritis. This medication is given for its anti-inflammatory and immunosuppressive effects. Prednisone is in a class of medications called corticosteroids. It works to treat patients with low levels of corticosteroids by replacing steroids that are normally produced naturally by the body. It works to treat other conditions by reducing swelling and redness and by changing the way the immune system works. Yup. Also used for Crohn's disease patient in a flare. Yep, sure is. That's right. Hey, it doesn't matter if you think it's wrong. Here's the thing. You're going to come across, it doesn't matter what NCLEX review you get. You could get Remar. You could get Kaplan. You could get Archer. Some of them are going to be wrong. But the majority of them are not going to be wrong. Okay? The majority of them are not going to be wrong. All right, cool. Looks like for the most part, everybody picked prednisone, right? So everybody know. Okay, so here's the thing that you need to know is that prednisone takes care of, it's an anti-inflammatory and is an immunosuppressant. I'm sorry, it's an anti-inflammatory and immunosuppressive medication. That's what it does, right? It tastes horrible. Look, I ain't never tasted prednisone. That sounds terrible, actually. All right, cool. We're already past 10. You already gave me 21,000 likes, so you already know what the deal is. We going to 21 questions. Hey, if you're new here, welcome. My name is Kevin. I go by the Boot Nurse on all social media platforms. And I am still the same Kevin, BSN, RN. For those that don't know, I've been a nurse for 3 years. I've worked in the ICU for a little over a year. I did a little bit of PACU, and I also now work in the operating room as a circulating nurse or a scrub nurse, whatever you guys want to call it. So yeah. Also, I failed my NCLEX 3 times, guys. I failed it 3 times. You want to know why I do this? Is because I never had anything like this. I didn't even know people did this online. And then I was just like, you know what? Let me do it. Because I don't ever want nobody to feel like I felt, which I felt like a failure. And I felt like there was nobody there for me. And then I ended up getting a mentor who happened to be a nurse. And he told me to get my shit together. So this is by me doing this for you. Hopefully, this is telling you at some point that you need to get your shit together. And we got to study and we got to get shit going. You feel me? All right, cool. Hey, biggest thing I want you guys to do is I want you to participate. All right? Because I'm kind of, sort of, but not really, but really funny. Like, I'm just saying. Spaghetti. I'm just saying. Sometimes I'm a funny guy, you know? Hey, the more likes or gifts, the more questions that you get, right? But hey, whatever. Do you. Like I said before, hey, we got 25 questions, right? So you already know how many likes you got to give me. At least 1 million. Yes, because that's how math works. I need 10,000 followers, y'all, so I can stream on the computer so I don't have to do this ghetto-ness that I got going on right here. You feel me? Okay. Also, my course, the 7-day NCLEX course, that link is in the bio. What is that course, you ask? It is my NCLEX course that I created for people that need it, obviously, right? It's going for $48. It's 80% off right now off its current price because it is in its pre-launch phase, which means I am updating content as well as new generation NCLEX material to include PowerPoints and questions. And those are going to be coming soon. Can't give you a specific date, but they're going to be coming soon. So if you're a nursing student and you just started school and you want to try to get a jump on your NCLEX, before you take your NCLEX, in another year, 2 years or whatever, hey, check it out. Get it for $48. You have it forever. Like, you'll have it forever. So make sure you guys go over there, check that out. That link is in my bio. Also, if you troll my chat, I've already gave 2 600s today. What is a 600, you ask? 600 means 600 seconds. 600 seconds equals 10 minutes. 10 minutes is how long I'm going to ban you. And when I say I'm going to ban you, it ain't for 10 minutes. I'm banning that ass off of this chat. Don't come in my chat acting a fool. As a matter of fact, I just ask y'all. I'll make it a democracy because chat already know what's up. The chat already knows what the deal is. You come into this chat and you act a fool. I'm like, chat, what do y'all want to do? It's kind of like Spartacus, where it's just like, what do y'all want to do? And it's always you come into the chat, you getting a 600. So don't act up. Also, I am not gatekeeping. I don't gatekeep. That's not what I do. So if you want to know where you can find questions like this, nurseslabs.com. That's where they're at. You can find them and they're free. You don't have to pay for them, right? But I just like to do this is because, we all congregate amongst one another. We all be friends and love each other, especially all 54 people that shared, because I need 10,000 people to love me and follow me so I can be unghetto. You know what I'm saying? Okay. So without further ado, now let us go on to some more questions. All right. Question number 11. Which of the following is least likely to influence the potential for a client to comply with lithium therapy after discharge? Now, think about it. What is lithium? Who is lithium prescribed to? I'm grateful for your help. You're welcome, Maria. I love to do this. I thoroughly enjoy doing this. Like, I don't think people really realize like how much I really enjoy doing this. Mood, bipolar. All right, I probably should have went over the answers, right? But the answers are the impact of lithium on the client's energy level and lifestyle, the need for consistent blood level monitoring, the potential side effects of lithium, or D, what do the client's friends think of his need to take medications? A, lithium is, yes, you are, is it Jeremiah? Jeremiah, did I say that right? You are correct, sir. Gotta be D. A, D, C, A. Grateful for your, to be your soul. I appreciate you being here. I appreciate you. Least likely.
Least likely. Keyword. Put it out. Hey, Rochelle, put it in there again. This is what, hey, who knows? If you know me, I'm always going to tell y'all RTFQ. Who knows what RTFQ is? Who knows what it means? And by the way, make sure you guys don't say the specific word and down there, because TikTok might just be like, hey, bro, oh, read it. Yeah, read it. Yeah, read it. Oh, exactly. There you go, Alex. There you go. That Rochelle, you know what's up. Read the question. Yo, y'all know what the deal is. All right, read it. Read it. All y'all's out here screaming, this is what it does. This is what it does. This is what it does. You better read it. Trust me, I'm guilty of it as well. Look, y'all, I am not perfect. Your boy failed his NCLEX 3 times. It took him 3 times to get off that beach. Because hey, you stay on that beach. There's only 2 people that stay on the beach. And if y'all know what I'm talking about, y'all know what I'm talking about. All right. Rex the yeah, there you go, Joanna. D. Ashley says D. All right, cool. So I think people have now reread the question, and I think we have a better understanding. So let us see what the answer is. And look at that. Look at that. The answer is D. D. I didn't read. You didn't. Yeah, you didn't. While the client's social network can influence the client in terms of compliance, the influence is typically secondary to that of other factors listed. Lithium acts on a person's central nervous system, right? Doctors don't know exactly how lithium works to stabilize a patient's or a person's mood, but it is thought to help strengthen nerve cell connections in brain regions that are available in regulating mood, thinking, and behavior. Sorry if I'm reading it kind of slow. I literally have been recording content all day, and your boy is tired. So them words are tricky. Please read all questions. Hey, read them all the way. See, now, if I didn't coach y'all through that, y'all would have all got that answer wrong. And then y'all would have been like, oh my God, it said least likely. Everybody getting the finger, all y'all, except for Sasha. But Rochelle, you getting it the worst. You understand me? You understand me? All right, cool. All right, so everybody understands when I say RTFQ, right? RTFQ. Then get untired. Golly. All right, cool. Get untired. She's like, I don't care if you want to take a nap and if you only have 4 hours of sleep, get over here and start teaching these questions. Yes, ma'am. You're right. I got you. Yeah, Rochelle had to learn the hard way. She knows what's up. She got it twice. All right, here we go. Question number 12. A male patient is to receive a percutaneously inserted central catheter, or a PICC line as we call it. He asked the nurse whether the insertion will hurt. How will the nurse reply? A, you will have general anesthesia, so you won't feel anything. It will be inserted rapidly and any discomfort is fleeting. C, the insertion site will be anesthetized. Threading the catheter through the vein is not painful. Or is it D, you will receive sedation prior to the procedure? Oh snap, Sandy's here. What up, Sandy? You make me, oh Sandy, oh Sandy. I'm sorry. Look, I'm sorry. I really got to get on some meds, yo, because I'll be out here acting a fool. Look, grease lightning. Anyways, yeah. So everybody's saying, so we got some C's, we got some. Did somebody say D up in here? All right. So hey, think about a PICC line, right? For all my LPNs, right? Can you do PICC lines? Can you do anything with PICC lines? Right? RNs. Can RNs place PICC lines? Right? Can RNs flush PICC lines? You see what I'm saying? Those are the things to think about, right? These are, by the way, this is an RN question, but I'm asking you this question because as an LPN, you need to know what you can't do. You need to know what your responsibilities are. On top of, if you get a question like this, you still need to be able to know it. You still need to be able to know it, because I could rewrite this, right? And or you could literally answer this question because he's just like, he asked the nurse whether it'll hurt. As somebody who learns about central venous access devices, you know the literature based off of how it's going to feel, right? RN IV and local at site. You got to have special training as an RN, right? Correct. You do have to have special training to do PICC lines, but RNs cannot do central lines. All right. All right, cool. Let's see what we got. You need to know for delegation. Facts. 100% you do. Answer is, it is C. The insertion site will be anesthetized. Threading the catheter through the vein is not painful. Sorry, guys, if this is so small, but the rationale is huge. That's what she said. Anyways, pain related to PICC insertion occurs with the puncture of the skin. When inserting PICC lines, the insertion site is anesthetized so no pain is felt. Unnecessary pain should be prevented. PICCs are subsets of central venous catheters. They are 50 to 60 centimeters long, double or triple lumen. Let me tell you right now, triple lumen PICCs are the best. They're triple lumen catheters that are placed in the peripheral arm vein and terminal or terminate. Oh my God, terminate in the thorax. I was about to say terminal. Oh Lord. They can be used for medium-term venous access, which is defined as anywhere between several weeks to 6 months. I've seen people have a PICC line up to a year, you know? So, but then again, this isn't about what I've seen in the real world. This is about what you see in perfect NCLEX book world, okay? I agree it's C, but not true. It can be pain. Oh, see, now you're not, Vicky, now you're tomato. Wait, tomato. Like it is painful. It will be painful at the beginning, right? But the answer is C. There's nothing we can do about that. But I trust me, I'm picking up what you're putting down. I know what you're talking about because I've seen people get PICC lines and it's not comfortable for them. I know it's not. So, but hey, but in NCLEX world, they don't feel no pain, okay? All right, question number 13. The nurse is caring for an elderly client who has been diagnosed with having sundown syndrome. Now, where's Victoria at? Victoria, you better answer this question. He is alert and oriented during the day, but becomes disoriented and disruptive around dinner time. He is hospitalized for evaluation. The nurse asked the client and his family to list all of his all the medications, prescriptions, and non-prescriptions he is currently taking. What is the primary reason for this action? The only reason I say Victoria is because we're talking about elderly people and sundowners. She's a CNA, right? Trying to be a nurse. So, all right. So A, multiple medications can lead to delirium. B, the medications can provide clues regarding his medical background. C, the ability to recall medications is a good assessment of the client's level of orientation. Or D, medications taken by a client are part of every nursing assessment. The client, your applesauce, your name is applesauce. The client. So we got D. Victoria says delirium. I feel like Victoria would have screamed that from the from the mountaintops, like delirium, echo. Rochelle says A. Okay. Applesauce. I see you. You say the client. I see you. Wait, what letter is that? Sandy says A. Okay. Shout out to all y'all. Shout out to all 150. Sasha got beat up last week after sundown. Oh, Lord of mercy. It says did I say delirium? I'm sorry, dementia. My bad. Thank you, Liza. I told you, hey, I've been recording content all day. Your boy is he's all over the place, but I'm here for y'all. I thought you were yelling at me, Liza. I can't interpret, attitudes through messages, you know what I'm saying? But I know you ain't yelling at me. I know you ain't yelling. Please give me a smiley face. I'm sensitive. All right, we got D, B. Cal says A. All right, cool. Shout out to all 204 of y'all. Oh, Liza, that's what I'm like. I appreciate you. Lola says D. Okay. Jeremiah says smiley face with teeth. Jeremiah, that is not the answer, sir. Okay. I'm going to need for you to give me an answer. She is, though. Okay. All right, cool. All right, check this out. So we'll go to this answer. Ready? Here we go. And 3, 2. The answer is A. All right. Multiple medications can lead to dementia. Liza, dementia. I was about to say delirium again. I ain't even gonna lie to you. All right, so drugs commonly used by elderly people, especially in combination, can lead to dementia. In general, sundown syndrome is characterized by the emergent or increment of neuropsychiatric syndromes such as agitation, confusion, anxiety, and aggressiveness in the late afternoon, in the evening, or at night. Sundowning is highly prevalent among individuals with dementia. It is thought to be associated with impaired circadian rhythmicity, environmental and social factors, and impaired cognition. All right. Look, these words be big. You know what I'm saying? They be big for no reason. They be big for no reason. Code Brown. Look, I've been in plenty of Code Browns. Let me tell you, them shits are not fun. Who's contribute? Wait, what are we talking about? What are y'all talking about? Ryan just shit himself. Lord of mercy. What are we talking about? Whatever, y'all. Y'all do y'all. I'm going to the next question. All right, number 14. A 25-year-old woman is in her 5th month of pregnancy. Hey, by the way, don't be surprised if you guys have done labor and delivery. They instead of saying the 5th month of pregnancy, they'll say like, what is it, G2, P1, T3, or whatever. I forgot what those are, and I'll brush up on those. I promise. But don't be surprised if they say that instead of being in the 5th month of pregnancy, right? She has been taking 20 units of MPH insulin for diabetes mellitus daily for 6 years. All right. Her diabetes has been well controlled with this dosage. She has been coming for routine prenatal visits during which diabetic teaching has been implemented. Which of the following statements indicates that the woman understands the teaching regarding her insulin during or her insulin needs during her pregnancy? Everybody is saying B. So, hey, so what type of, since she's 25 and she's pregnant, what type of diabetes is this? Right? But A, it says, are you sure all this insulin won't hurt my baby? Is it B? I'll probably need insulin. I'll probably need my daily insulin dose raised. Or C, I will continue to take my regular dose of insulin. Or is it D? These finger sticks make my hand sore. Can I do them less frequently? I see B. Joanna, you are correct. B. Got some C's. A whole bunch of y'all said B. I had to scroll back up because y'all were talking about Code Browns. And I hope by Code Brown, by Code Brown, better be code answer B. So, all right. So we got some C's, got some B's. The C's get degrees, but the D's do not. I want to say C. What do you mean you want to say C? You just said it, ma'am. Come on. Patrick said pregnant diabetics require more finger sticks and possibly more insulin. Answer is B. My man's dying on that hill. That's what I'm talking about. You should take take a page out of that man's book, Sasha and Rochelle. Type 2, and it's not D. And Victoria. That man about to die on that hill. He said it with confidence. And even if he's wrong, I would still give him the answer. But it ain't my choice because I don't grade stuff. So my guess is C makes the most sense. Okay, T baby. All right, I'm done. God damn. Yo, shout out to all 210 of y'all just listen to me act a fool. All right, gestational diabetes. Okay, all right. I think we got a general consensus. All right, C for sure. All right, cool. Let's see what the answer is in 3, 2. The answer is B. I'll probably need my daily insulin dose raised. Honestly, I don't know about this one. Sorry, Jeremiah. There go the answer right there. Same thing applies before surgery. Yup. There it goes. All right. The client starts to need increased insulin in the 2nd trimester. As a result of the placental maturation and placental production, insulin requirements begin increasing in the 2nd trimester and may double or quadruple by the end of pregnancy. Insulin doses depend on blood glucose levels. Extra testing can be an extreme burden on patients, but may be necessary for a short time for aggressive insulin treatment to achieve glycemic goals in a timely manner. Regardless of the method of initiating or adjusting insulin, aggressive management is necessary to attain quick glucose control. Maintaining tight control throughout pregnancy will require close and frequent monitoring to prescribe appropriate doses. Sorry. I haven't even started school yet. Look, you ain't started school yet, but you already here. Rochelle said, well. Oh my God, keep me out of. Hey, look, don't put me in L&D. Y'all already. If y'all don't know the story about me when I was in L&D, and I saw this one lady in there, and she had four different dudes in there. One was the husband, the other one was a brother, the other one was a cousin, and I don't know who the fourth guy was. I was just like, yeah, this is gonna be a no for me, dog. It's gonna be a no for me. Taking the NCLEX this Wednesday. 80 Marcy B. This is gonna be your last day studying anything. You are not going to study anything. You are going to relax tomorrow. You are not going to do any NCLEX anything because if you've been studying like you have been, which I'm sure you have, you know it. You know what you're ready for it. Okay. Because if you try to cram all the way up to the day before, if you're doing that, if you don't know it by now, you don't know it all. The NCLEX is all about being familiar. It's not all about memorizing, although there are specific things you need to memorize. Okay. So you got this. You got this. All right, cool. On to the next question. Question number 15. Is it Johansson? Mrs. Johansson's physician has prescribed tetracycline 500 milligrams PO Q6H, right, every 6 hours. While assessing Mrs. Johansson's nursing history for allergies, the nurse notes that Mrs. Johansson is also taking oral contraceptives. What is the most appropriate initial nursing intervention? Is it A, administer the dose of doxycycline or tetracycline? B, notify the physician that Mrs. Johansson is taking an oral contraceptive? C, tell Mrs. Johansson she should stop taking oral contraceptives since they are inactivated by tetracycline? Or is it D, tell Mrs. Johansson to use another form of birth control for at least 2 months? Baby boop, baby boop. Oh, you hear him, right? Yeah, there he is. Like backup singer back there doing his thing. For a second, I thought I heard a cat. Victoria, did you just call my son a cat? Victoria, did you just call my son a cat? You said D. Rose says D. Okay. Is it foul? Foul? Is it? I don't even know. Baby is saying D. You call my son a cat. Hey, I'm about to give Victoria 600. Hey, who wants Victoria to get a 600 right now? I'm just playing. We ain't gonna look. We ain't gonna give you a 600. We ain't gonna give you one because because you don't deserve that. He do sound like a cat sometimes. Sometimes he sound like the dog. Oh my god. No, she's cool. Hey, look at that. Look at that. They saving you out here because you already know what happens to coming to my chat. You getting a 600, you acting a fool, okay? All right, so people are kind of all over the place. It says, no, actually, I think B, we got D, you got D, right? Hey, so think about it. Think about it. Some of these are right, but which one is more right? What is the initial? What does the initial mean? What does the word initial mean? Right? I passed NCLEX and I'm really thinking B, that's the order of events. Okay. Okay. Shout out to you, Cheeto Dust. Your Cheeto Dust. Is it like hot Cheeto Dust? I'm sorry, lemon lime Cheeto Dust because those are delicious. Jennifer says first. That's what initial. That's what the word initial means. Everybody's saying B. We got some D's. Okay. All right. Everybody's kind of all over the place. So all of them, ma'am, respectfully, that ain't it. All right. And now you the first person to get a finger. Okay. Don't do that. You can't do that. Okay. Never mind. I said B because initial. Okay. Do you think that you will be able to wait? What the hell? Do the first thing. Okay, y'all are asking a whole bunch. Do the first thing that you are able to do as a nurse educate. Okay, I got you. All the Cheetos, all of them. Oh my God, the finger. All right, here we go. Here we go. All right, so the answer is B. Notify the physician that Mrs. Johansson is taking oral contraceptives. The nurse should be aware that tetracycline decreases the effectiveness of oral contraceptives. The physician should be notified. Note on the client's chart that the physician was notified because if you didn't document, y'all go ahead and finish the rest of that. The two groups of antibiotics most commonly involved in contraceptive failure are tetracyclines and penicillins, namely ampicillin. Both ampicillin and tetracycline have been shown to affect plasma and urinary concentrations of estrogen in both pregnant and non-pregnant women, while progesterone levels remain constant. Oh, all right. Sorry, my NCLEX is in November. Hold on, guys. As a matter of fact, hold on. Let me see something. Oh, found it. We're Gucci now. All right, how we doing? Is it better?
Is it better? Sandy says better. Good. Victoria says better. Cool. Muffled. I'm still muffled? Way better? Okay. Jeremiah says better. Yep. Rochelle says good. Sweet. Hey, make sure y'all smash that like button. Smash it. I need y'all to destroy. Hey, I just want to let y'all know I got 40,000 likes on Friday. Sasha, these people gave me 40,000 likes. You feel me? They gave me 40,000 likes. I don't even know what I deserve. Why I deserve that. I don't even know why. But shout out to y'all. I love y'all. Next question. Oh, look at that. Hey, we're on a break. I would actually pause this right now, but I'm not going to because we're right on the roll. Hey, if you are new here, welcome to the stream. Welcome to the TikTok Live. My name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys go check those out. Subscribe to my YouTube. If you know anybody that needs these type of questions, you guys can go check them out over on my YouTube channel. Because every TikTok Live will go up there. Every single one. It'll probably be a couple hours. So if you want to make it a study session for yourself, boom, do your thing. Okay. Participate. I want you guys to participate. All right. Participation is key. I'm kind of, sort of, not really, but really kind of funny. Sometimes it all just depends on what you say. And, but I want you guys to participate, even though I do not, answer all the questions all the time because I can't see them. You guys can answer each other's questions in there. Okay. Hey, so the more that you like, the more, or gifts or whatever, the more questions you get, but whatever, do you, boo? We got 25 questions total. So guess how many likes you got to give me? 1 million. That's right. Sponsored by Gatorade. Look. If I was sponsored by Gatorade, that'd actually be pretty good. I'd actually love that. I need 10,000 followers so I can stream on the computer because streaming on the phone is ghetto. Like, it's ghetto. In the ghetto. All right. So, I need for y'all to love me, and tell other people to love me, even if they don't love me. Okay. Just follow me for whatever. All right. Just do it. Make it happen. By the way, I will always talk about my course because the course is my baby and it's what I've created. Why I created it is because I created it for other people because I don't want people to ever feel how I felt, like they were a failure or like they were lost. And this course will give you that direction. That course, 7-day NCLEX course, the link is in my bio. It's for $48. It's 80% off. Once you get it forever, to include all the updates that are going to come with it. That's why it's in its pre-launch phase. And that is my gift to those who decide that they want to be an early adopter and build the Spirit airline so we can get to Emirates, baby, because that's what we're doing. All right. So the link is in the bio. You come into my chat and you act a fool. I'm going to troll you. And then you're going to get a 600. What is a 600, you might ask? A 600 means 600 seconds, which equals 10 minutes. And that's how long I'm going to ban you. But 10 minutes means I'm going to ban you forever. Okay. And then I'm going to leave it up to the chat. You act a fool. I'm like, chat, what y'all want to do? General consensus, that ass got to go. All right. So don't be coming up here acting up a fool. You know what I'm saying? So I don't gatekeep. People come at me saying like, hey, where do you get these questions? Like, they're free. Why are you doing this? Okay, bitch, this is free. What you mean? So, hey, don't be coming out. Hey, don't come out of pocket. Don't do it. Don't do it to me now. All right. So I don't gatekeep. If you guys want to go find where these questions are, right there, nurseslabs.com. If you're a brand new nurse and you are in fundamentals, especially, or if you're about to start school and go to fundamentals, this is a great website to go to. A great website to go to get your nursing knowledge, especially when you're trying to learn about the nursing process and the nursing diagnosis, right? When you're doing those care plans, because let me tell you something right now, them care plans, they are the death. They are the death of everything because they are. But I mean, they're helpful, but they suck. How do I pass my basic nursing classes? I'm having a little trouble. You got to give us a little bit more context. Give us a little bit more context, but we're going to roll. Do they have NGN questions there? I don't think so, honestly. I think they might be updating with with NGN questions, but regardless if they have NGN questions or not, doing the free questions will get you into the study mode of like, hey, I don't understand that. Well, let me go and let me do a little bit more research for myself. Okay. Also, if you're a brand new nurse, I want to know who you are, where you're from. If you're new here, I'm sorry. I want to know who you are, where you're from, and where you're at in your nursing journey. Are you about to start it? Have you been a nurse for a while? You in school? You in prerequisites? I want to know it all. Like, let us do that conversation, and y'all had that conversation down there, and then every so often, I'm my answer. All right, here we go. Question number 16. An adult client's insulin dose is 10 units of regular insulin and 15 units of NPH insulin in the morning. The client should be taught to expect the first insulin peak essentially when? As soon as the food is ingested, in 2 to 4 hours, in 6 hours, or in 12 to or 10 to 12 hours. Regular insulin doesn't peak. Okay. Megan says A. Regular insulin is fast acting. You were very right. So here's the thing. How fast acting? But you got to think. So you have, what is it? You have onset, you have the duration, and you have the peak, or the onset, peak, and then the duration. Right? When it comes to your insulins. Change to A. You sure, Sandy? You sure about that? FMF Gomez. That's not the type of FMF that I'm thinking, is it? That's not A. You say A. You got B. Sandy said no. Oh my God. FMF Gomez. What does FMF stand for? I'm curious. Is that Navy Marine Corps FMF? That's what I'm asking. Mohammed says B. B. Daughter says B. Okay. All right. I look. A bunch of y'all. Let's see. Some of y'all said B. Oh, a bunch of y'all said B. B, A, B, 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 B. So B looks like the general consensus of the answer. So let's see what it is. And the answer, of course, is B, in 2 to 4 hours. The first insulin peak will occur 2 to 4 hours after administration of regular insulin. Regular insulin is classified as rapid acting and will peak 2 to 4 hours after administration. The second peak will be 8 to 12 hours after the administration of NPH insulin. This is why a snack must be eaten mid-morning and also 3 to 4 hours after the evening meal. Yes, got it right. Yeah, you got it right. That's what I'm talking about. Hey, pat yourselves on the back, because this is a testament to you. Like, if you aren't doing so well, you know where you got to work at, right? You could just need to get into the swing of doing the questions. And if you're doing well, cool. Pharmacology may just be where you're good to go, right? But then, hey, you got to think about all those other pharmacology questions that are out there, especially cardiac. You know what I'm saying? All right, here we go. All right, question 17. An adult is hospitalized for, for treatment of deep electrical burns. So now we're talking about a burn patient. Burn wound sepsis develops. And, sulfamylon is ordered BID. While applying the sulfamylon to the wound, it is important for the nurse to prepare the client for expected responses to the topical application, which include A, severe burning pain for a few minutes following application, B, possible severe metabolic alkalosis with continued use, D, black discoloration of everything that comes in contact with the drug, or D, chilling due to evaporation of solution from the moistened dressings. Lisa says C, Rochelle says A. This is a tough one. This is a wound care. Okay. Nat says A. Okay. Nat says A. Joanna says good question. Okay. User 12 says A. Okay. Elisa says A. Yvonne says A. Miss Handy says A. Okay. Let's see. Let's get some more questions. Let's get some more answers in there. All right, Elaine says A. Who said A with the question mark? Who said that? Nat? Okay. Said A with the question mark. Nat, are you just saying question mark because, like, you don't know, or are you just saying A because everybody else does and you're just like, look, let me just follow the crowd? Neighborhood nurse says A. Okay. K says D. Okay. All right. No, I don't know. I don't know what to put. That's fine. If you don't know what to put, that's a great thing. You can guess. And then when you read the rationales, you're just like, oh, okay, that makes sense. All right. So let's check it out. The answer is A. Look at that. Nat. You guessed and you got it right. Or you did the herd mentality and followed everybody else, and that's fine. Sulfamylon does cause burning on application. An anesthetic may be required during the ointment, before the ointment is applied. Sulfamylon is a topical antibiotic used to prevent infection in severe burns. Common side effects of sulfamylon include skin rash, redness, or itching, or pain, burning, or redness of the treated skin areas. Yeah, Vicky, it was A. It was A. Shout out to all 133 of y'all rocking with me. Appreciate y'all being here. Y'all got me 26,000 likes. Look at y'all. Man, oh man, I appreciate y'all. I'm going to roll on to the next one. Hey, another thing is, even if you got this right, read your answer choices that were incorrect. So you will never know by reading this how much more knowledge you'll get and that you can apply to another question later on down the line. All right. All right. Question 18. Miss Clark has hyperthyroidism and is scheduled for a thyroidectomy. The physician has ordered a Lugol solution for the client. The nurse understands that the primary reason for giving Lugol solution preoperatively is to what? Decrease the risk of, agranulocytosis postoperatively, prevent tetany while the client is under general anesthesia, reduce the size and vascularity of the thyroid and prevent hemorrhage? Or is it D, potentiate the effect of the other preoperative medication so less medicine can be given while the client is under anesthesia? I'm not going to lie to y'all. I heard my son outside the door. I started laughing because last time he had his fingers all under the door. He was banging on the door. We had a whole conversation. Y'all missed that live. If y'all didn't see that live, I don't even know what day it was, but that was fucking hilarious. All right, we got a bunch of C's. Okay. Okay, C. C. Thanks for the follow, Chelsea Ray. I'm going to start paying more attention to that and giving y'all shout outs. I appreciate y'all following. I'm dead, just like the cat or dog. Look, I'm trying to tell y'all, this dude came up in here with like blah, 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 blah. It's kind of like where Kevin Hart, which is his daughter, was talking about. He was like, Guma Gama, juice. And he's like, who the fuck you think you talking to? But, I don't talk to my son like that because I just be beating him up anyway. How many kids? I have one. I have one kid. I have one. Sandy, I'm not even gonna lie to you. No idea what it is. Not even gonna lie to you. Like I said, I have no problem telling you about something I ain't never heard before. This is my first time hearing it. I've never heard of this treatment. Neither have I. At this point, I guess. So it's just like, okay, so it's when it comes to questions like, well, let's say with this medication, like you don't know it, right? But you do know the patient has hyperthyroidism, right? So what are the signs and symptoms of hyperthyroidism? Sometimes you can reverse engineer based off of what you know to apply it to what you don't know. I'm an MP and I don't know either. My best educated guess would be C. All right, Tracy, shout out to you. Some people get embarrassed and they're just like, oh no, I know all the answers. Look, bro, I don't know all the answers. Sorry. I don't. All right. I think everybody's answered enough. I think the majority of people pick C. So let's see what the answer is. The answer is C. Reduce the size of and vascularity of the thyroid and prevent hemorrhage. A really good way to think about that is if we go back to all the things that are happening here, like if we say like, hey, what's the primary reason is like hemorrhage? Because where's the thyroid? I was about to point, it's in your throat, but the thyroid is in your throat, right? The biggest thing that I want to do is I want to prevent hemorrhage. So a lot of times you can read these answers when you're not understanding the question and the answers can pop out to you. Okay. All right. Let's see. The client may receive an iodine solution, which is a Lugol solution, for 10 to 14 days before surgery to decrease vascularity of the thyroid and thus prevent excessive bleeding. Plummer observed a 75% decrease in mortality associated with thyroidectomies when Lugol's solution was introduced. At that time, metabolic rate decreased as well as symptoms. You know what? I actually like that one. And it's funny enough, I just recorded a lecture for the course for hypo and hyperthyroidism. And I was talking about iodine solutions, but not Lugol solutions specifically. All right. Thanks for all the follows. Shout out to Jennifer. Shout out to Genesis. Shout out to Grace. Appreciate the follows. All right. All right. Shout out to all of y'all. Shout out to all 163 of y'all, man. We out here rocking. We're on question 19. Here we go. A 2-year-old child with congestive heart failure has been receiving digoxin for 1 week. The nurse needs to recognize that an early sign of digitalis toxicity is what? Rochelle, you better be the first to answer. Is it bradypnea, failure to thrive, tachycardia, or vomiting? Well, Lisa says A. Elaine says C. Yvonne says D. Luke says D. Rose says T. Rose, ma'am. Rose, come here. Come here. We need to talk. Ma'am, T ain't even on there. Oh, you said C? My bad. I don't know why I'm yelling. Hey, I don't even know why I'm yelling out here. You know what I'm saying? Wait, is T right next to the C? T is on a different part of the keyboard. Joanna says D. Sandy says D. Oh, man. I'm adult certified. D. That's okay. That's okay. Hey, look, I had PAL. I think everybody should take PALs in my opinion. But little people scare me. But I'm saying it's a really big part of that. Shared the live more than 5 times. Hey, shout out to you for sharing it 5 times. Lord of mercy. Vicky says A. Leah says D? Question mark. Thanks for the follow, Melly. Thanks, Jackie, for the follow. Early sign is key. Early sign is the key. All right. Unique says D. K says D. Is it Platy or Platty? Platty Fitness says D. Little folks scare me. Look, I'm trying to tell you. When I saw a kid have tetralogy of Fallot, I was like, bro, I don't even know what to do. Like, please help me. Like, hey, God, it's me again. Definitely D. Thanks for the rose, Jackie. I appreciate it. Jackie over here giving me roses like that, like the old lady that's outside of the bars. She's just like, rose, $5. Nope, I don't want it. I mean, but I'll take that one. Well, I appreciate you. Yep. Key is early here, and D says D. All right, so we kind of like all over the place. Got some D's, got some C's, got some A's, throw some D's on it. Brady Pena. All right. So break it down. Answer, please, Jessica. Can I get a smiley face after the please? Well, at least you said please, so I'll give you the answer. I totally skipped it. Hold on, let me go back. There it is. It's D. Vomiting. There you go, Jess. Appreciate it. Slow breathing, right? Slow breathing. All right. The early sign of dig toxicity is vomiting, although one episode does not warrant discontinuing the medication. Digitalis is a plant-derived cardiac glycoside commonly used in the treatment of chronic heart failure, atrial fibrillation, and supraventricular tachycardia. Digoxin is the only available preparation of digitalis in the United States. All right. Yes, got it right. Shout out to you, Joanna. Who asked about bradypnea? Slow breathing. It is not associated with digitalis toxicity. Bradycardia is associated with digitalis toxicity. See, now this is why I say we got to read, because I'm not even gonna lie. When I first started reading this, I was like that's why I had to stop, and I was like, that doesn't say bradycardia, that says bradypnea. All right, and that is not a side effect. Okay, dang, I need to read it as See, look at that. That's why I stopped myself, because of that. That's why you got to slow down, and you got to RTFQ. All right. The only way I remember what Brady is I think about Brady is slow. I think about Tom Brady because he is slow. Not upstairs, but he just can't run really fast. Oh my God. All right, I'm done. All right, so cool. We got the answer. Which is vomiting. Yeah, so our early sign is also halo, but Valencia, that is not on here. Okay? So even though halo signs could be, but you also got to think, this is a 2-year-old. Is a 2-year-old going to tell you what a halo is? Think about that. All right. I see the logic. All right, Rose, I appreciate it. All right, cool. Question 20. Shout out to y'all. 20 questions. Mr. Bates is admitted to the surgical ICU following left adrenal ectomy. All right. Think about, adrenal ectomy. What does that mean? What does ectomy mean? Okay. He is sleeping, but easily aroused. An IV containing hydrocortisone is running. The nurse planning care for Mr. Bates knows it is essential to include which of the following nursing interventions at this time. What does South mean? I don't know. South side, the realest, drugs, fill us, kill us. All right, I'm sorry. So we got A, monitor blood glucose levels every shift to detect the development of hypo or hyperglycemia. B, keep flat on bed or keep flat on back with minimal movement to reduce the risk of hemorrhage following surgery. Is it C, administer hydrocortisone until vital signs stabilize, then discontinue the IV? Or is it D, teach Mr. Bates how to care for his wound since he is at high risk for developing post-operative infection? We got A's all over the place. Joanna, why are you dead? What happened? What'd I do? I see the logic, but it is also on young kids. Exactly. Yep. South. Yep. 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 A. Glucose levels need to be monitored. Okay. Plano says D. GG. Is it GG or Jai? I'm gonna call you Jai or Jai G. You know what? You with the green body and the eyeball. A. I got you. TikToker says glucose. Yvonne says A. Precious says A. Jessica, Rose, Mohammed, Brittany, Vicky all say A. Shout out to all y'all for answering. Shout out to all 182 of y'all. We're doing NCLEX questions specifically for pharmacology, and it was a request. So that's ones that we're doing tonight. All right. Let's see what we got. Thanks, Luke, for the follow. Appreciate you. I said I'm dead about the Tom Brady. Oh, yeah, because he is slow. He's slower than a motherfucker. So, Sabrina, thank you for the follow. I appreciate it. What's up, Jason? I see you in there giving all the likes, brother. I appreciate you. Shayla, thank you for the likes. Debbie says C. Let's see what the answer is. The answer is A. We want to monitor blood glucose levels every shift Whoever just gave me a crown, whatever that was, scared the living shit out of me because I was reading. But thank you so much, neighborhood nurse, for the crown. I appreciate it. Hydrocortisone promotes gluconeogenesis and elevates blood glucose levels. Following adrenalectomy, the normal supply of hydrocortisone is interrupted and must be replaced to maintain the blood glucose at normal levels. Care for the client following adrenalectomy is similar to that of any abdominal operation, right? Yes, rebound, hypoglycemia. Look, it's crazy if you go in there and you see somebody and they're alert and they're doing okay. And then next thing you know, you go back and they're just looking at you. They're staring at you like obtundant, like, you know what I'm saying? Like they're just staring, like they're giving you 1,000-yard stare, like burning a hole through your forehead. And you're going to be like, hey, are you okay? And then it takes them like all of 10 to 20 seconds to answer you. And you're like, what the hell is going on here? Right? So that should be your cue to be like, hey, what's going on? Now you got to do a full assessment to see what's going on with this person, right? So, Destiny says, thank you for doing this. Pharmacology has always been hard for me. Destiny, you're very welcome. I'm trying to tell everybody, I failed my NCLEX 3 times. Pharmacology was the worst section for me. All right. There we go. All right. Shout out. Yeah, you're welcome. Hope I'm not too late. Misha, we are already on question 20. And this is something that I want to show everybody if you've never been here before. This right here, if you guys can see that, this was my NCLEX failure, right? Look at that. And this was in 2019, right? This was my NCLEX failure. And it talks about it: management of care, safety, health promotion, psychosocial, basic care and comfort, pharmacology. Pharmacology is 12 to 18%. Management of care is 17 to 23%. They're a little skewed now, but it's a little bit different, right? But still, that's what it looked like. And this is what it looked like when I failed for the second time, right? So I'm trying to tell y'all, this is what this means. You need to do this in order to make yourself familiar and to get into a routine. Okay, that's what it's for. Okay. I'm on my fourth semester in nursing school. Thank you for this. You're very welcome. Thank you, everybody, for all the likes. Thank you, everybody, for all of the follows. Those are the most important because, I'm trying to get unghetto out here. Shout out to all 280 y'all that are in here listening to me run my mouth. I know Joanna told me to drink some water, but I got this Gatorade, not sponsored. You know what I'm saying? So shout out to all y'all for being up in here. If you guys are new here, my name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys go over to all of them. You can Google the Boot Nurse and I will pop up. So follow me on Instagram, YouTube. If you know somebody that misses this and they need this, tell them to check out my YouTube channel and they could go over NCLEX style questions and see how we break them down and how, all that good stuff, right? Participation is the key. I want you guys to participate. If I can't answer your question, you guys imagine this being a class of 200 plus people where you guys can vibe off of each other as well as answer each other's questions. Okay, this is a good conducive learning environment. And so not saying that your answers are wrong, but if your answer is wrong, you're going to learn why your answer is wrong. Either I'll tell you or somebody else in here will tell you. Okay, so participate. I'm kind of, sort of, not really, but really kind of funny. I really need my own stand up just because I'm kind of full of myself sometimes. Nah, I'm just playing. Hey, shout out to y'all. I love y'all so much. The more you like, the more gifts. The more you like and the more gifts, if you decide to give one, the more questions that you get. But if not, hey, whatever, do you, boo. Doesn't hurt my feelings. I'm just saying that, the likes are appreciated. There's 25 questions, 25 questions total. So you know how many likes y'all need to give me? At least 25 in a million, but y'all got me at 31. So I appreciate that. I need 10,000 followers so I don't got to be ghetto and stream like this. So there's that. I will always talk about my course because that's what I like to talk about. My course, the 7-day NCLEX course, is in its pre-launch phase. That link is in my bio. The course is going for $48, which is 80% off of the normal value. Once you get it forever. And it's in the pre-launches because we are consistently updating it every two weeks, 2 to 4 weeks. It's being updated. As of right now, I have probably about 9 plus 5. 9, 10, 11, 12, 13, like almost 15 videos of content that are going to be going up, as well as new generation NCLEX PowerPoints, just like this, to where we're going to be going through questions and breaking them down. And those are in the works, and hopefully we'll have those done soon within the next couple of weeks. Okay. So anybody interested, check it out, especially if you're a brand new nurse and you want to get a jump on your NCLEX now. You don't graduate for we'll say 6 months, a year, 2 years. I mean, you be that person to be like, hey, I got an NCLEX review for $48. What did you get? You know what I'm saying? We're building this Spirit airline so we can be Emirates out here. Pay $10,000 for a first class seat and fly 15 hours and take a nap and get like moist towelettes or whatever they give. I don't know. Y'all know what I'm talking about. Shout out to y'all. Don't troll my chat. Don't come in here acting stupid. Don't come in here acting a fool. Like I said, this is a conducive learning environment. Don't do that. Because I don't play about me and mine, and all 168 of y'all are mine. So when people come in, and by the way, I used to be a surgical tech instructor, and I'm a preceptor at work and all this other stuff. So when a student is with me, I don't play them games. I was like, I protect them at all costs. So don't do it. Don't do it. All right. You troll, I'm gonna troll you back, or I may go off on you. Whichever I feel like doing. And then I'm going to give you a 600. What's that, you ask? That's 600 seconds. 600 seconds equals 10 minutes, and that's how long I'm going to ban you. And by that, I'm just going to ban you forever. And then, but before I do that, I'm just going to ask the chat, what y'all want to do? Do I want to ban them or y'all want to keep them? And then as soon as I see one 600, it's over. It's kind of like Spartacus, right? So I'm just keeping it all the way real. Hey, and I don't gatekeep. If anybody wants to know where I got these questions, I got them from nurselab.com. Just like that. This is free. Right there. This TikTok is free, right? We're getting all this knowledge. We being friends and shit, you know what I'm saying? So look, I'm just saying, I don't gatekeep. Hey, don't come after me and be like, oh, you're doing free stuff. Anybody can do this. Hey, I'm telling you right now, you're right. Anybody can go and do these questions. But I feel like this environment right here is so much better to do questions because at least we get to conversate with one another instead of you sitting in a damn dark ass room trying to figure out why you got the question wrong, then getting frustrated and then going away. You feel me? So that's it. Love y'all. Appreciate everybody's liking us, following. You're a nurse. You're a nurse's nurse. Heck yeah. Yo, I'm just trying to keep it real. Do some more. What's the difference between preceptors and charge nurse? So a preceptor is essentially, that nurse that's teaching another nurse or teaching another student. And the charge nurse is in charge of the unit itself. So they're responsible of making the assignments. If there's codes that's going on, they're like the one who's like, they're the head nurse that's in charge of the unit for that shift. Okay. Do you help with HESI exits? Is it Frydane? I don't want to mess your name up, but Frydane. I don't help with exit HESIs. However, if I remember what the exit HESI is, that should consist of like the majority of it is management of care. If I remember right, because I took a HESI when I was in school as well. So, but YouTube is great. YouTube is great for exit HESIs. They really are. Question number 21. Corrine is experiencing diarrhea after consuming her prescribed antibiotics for a whole week. This is because the drugs render food indigestible. B, gastric flora is disturbed. Is it C, fluid is added into the intestines, or is it D, normal intestinal bacteria are destroyed? We got B, we got D. What else we got? Oh, there's 12 of y'all. I ain't even see them. B. Allegra Rose. I just want to let you know, Allegra, I took one of those this morning. I don't know how that makes you feel. I had a runny nose and I had an itchy eyes. So, yeah, there's that. Oh, my God. Valentina says D. Joanna says B. Okay. Okay. It's an old one. What you mean it's an old? Oh, I'm assuming because you say it's Allegra, you're like, oh, that's an old joke. Kevin, come up with a new one. Look, Allegra, if you want me to roast you, I will roast you. Allegra roast instead of Allegra rose. What you mean? Misha says B. Hey, Allegra, give me enough time. I'll come up with something good. I'll come up with something good. I'll do it. Is it Tasia? Tasia says D. I think that's what she said. I think D because antibiotics kill off other microbes good for us. Yes, they do. Sarah said she should take some Allegra and go to sleep. Damn. Sarah with the fire. Shots fired. Hey, look, I ain't do nothing. I'm over here instigating. Say it again, Sarah. Say it again. Say it again. All right, so we got D. Oh my God. Give us, hey, Lydia, first of all, don't do that. Don't do that. We up in here having a good time. I'm getting to the answer. Golly, here we go. I've seen enough C. diff. Look, let me tell you about C. diff. That shit nasty. All right, so the answer is D. Normal intestinal bacteria are destroyed. The destruction of normal intestinal flora causes diarrhea. Bacteria in the gut, for example, helps break down food. Antibiotics kill these good microbes along with bacteria that are causing an infection. This upsets the balance of the normal flora in the intestines. The result is often loose, watery stools associated as antibiotic associated diarrhea, also known as C. diff. And let me tell you something. Once you smell C. diff, it will always be burned into your nostrils. Doesn't matter what you do, it's always going to be there. Allegra's window. Allegra's window is cute. I don't even know what happened. Y'all are in there talking about Allegra. I feel like I started something. My bad. Oh my goodness. But yeah, so there's that. All right. Hey, by the way, if y'all want me to go to the next question, that's cool. I'll go to the next question. I just want to make sure that everybody's getting a chance to answer. But then if you ask me for a question, you better put a smiley face at the end of it because I'm assuming that you're yelling at me and I don't like being yelled at because I'm sensitive and I cry about everything, mostly because I'm a bitch. I'm just playing. But I appreciate y'all. Let's see. Yes, look it up. She was so cute. Oh, look, I can't look her up right now. It's a show. Let's talk about the NCLEX and not silly. What? Let's talk about the NCLEX and not silly people, right? People mad for no reason. What's wrong with y'all? Now what y'all talking about? Nah, they can wait until you explain it. Oh, okay, Misha, that's what I'm talking about, girl. That's what I'm talking about. But who want to get a 600? Because I'm ready to give somebody one because people acting out of pocket. Here we go. Question number 22. When a client with chronic obstructive pulmonary disease is taking theophylline, also receives ciprofloxacin, also known as Cipro, which of the following indications can occur or would occur? Ciprotoxicity, ineffectiveness of ciprofloxacin, theophylline toxicity, or ineffective theophylline. Allegra says LOL. I don't think that's an answer, but whatever. You got C. I actually have no clue with this question. That's okay, Jackie. Do you do these reviews every night? No, I do them 3 times a week. So Monday, Wednesday, Friday at 17:30 or Central Standard Time, also known as Texas time. That's the only, that's the only state that matters, and it's the only time. I'm just kidding. But yeah, Monday, Wednesday, Friday. Yvonne says C. Norma, thank you for the follow. I appreciate you. Hey, make sure you guys share and let everybody know what's going on. Vicky says C. Okay. All right. And it's okay that you don't know the answer. I don't expect you to know the answers. Hell, I don't know all the answers, but I bet you if you gave me a 75 question or 85 question quiz, I would pass. Because remember, it's not about knowing everything. It's all about knowing what everybody else knows so you can pass. Theophylline is still used, but not that often. So, okay. All right, Liza, shout out to you. Let's see. All right. It says C. Some people respond to it. Yeah. All right, cool. Let's see what the answer be. The answer is C, theophylline toxicity. Theophylline toxicity may occur because the action of theophylline is increased when given with ciprofloxacin. Theophylline has an extreme narrow therapeutic window. Theophylline toxicity occurs when serum theophylline levels surpass the levels in the therapeutic range. This can occur by intentional overdose or unintentional when metabolism and or clearance of theophylline is altered due to certain physiological stressors. Lord have mercy. Never have I thought that I would say that word so many times. Can you get some tips on how to answer it if you don't know the answer, like what context clues, so on and so forth? So there's some. I'll be completely honest. For this one, I know with Cipro is a really strong antibiotic, right? But based off of this question, for me personally, I wouldn't even know how to answer this. I literally would guess at this because I would guess at this, and then this would be the one that I would have to come back and look at. So I can't give you any context clues specifically in this one because that is where I falter in this specific range. I'll be completely honest. It's pronounced the awfulin. Oh, thiophyline. Oh, okay, cool. Hey, look, I already said that I'm not part of the spelling bee, and I don't say shit right. And plus, I've been recording content all day, so your boy's kind of tired. So gotta cut me some slack. Gotta cut me some slack. Okay. I remember somebody tried to do that when I was teaching something. I was like, damn, I've been saying it wrong the whole time. My bad. And then somebody was just like, how are you credentialed? I was like, I'm credentialed by mispronouncing it. Shut up. Get out of my face. That's no shade to you. I'm just saying somebody was just being real dumb. All right, here we go. Question number 22. The client at highest risk for nephrotoxicity with aminoglycoside use is a who? A male with a creatinine of 1.7 and a BUN of 52 on a 10-day regimen? Or is it B, female with a BUN of 12 and creatinine of 0.8? Female with past history of cystitis on 5 days of therapy? Or a male with a history of kidney stones on 8 days of therapy? Tom says A. Shout out to everybody that's following. Vince the Great, thank you for the follow. Jerica, and I'm guessing it's Mr. Sinister. Thank you for the follow. Got A. Okay. All right, cool. Got A. All right. A. All right. So here's a good question. So I'll give you some context clues. Who was it? I think it was Valentina that had asked this, right? So an aminoglycoside is what? Right? Got A. Yeah, got A. So when you think about this, it's like, so this is a medication, right? Yeah, it's an antibiotic, right? So you got to, what, like, this is like an aminoglycoside. It is an antibiotic, but it is a very powerful antibiotic, right? Like neomycin, kanamycin, so on and so forth. Once you think about that, you're gonna be like, man, if this is a very, very potent antibiotic that causes nephrotoxicity, nephro meaning what? Kidney, right? Toxicity meaning above the therapeutic line, right? It monitors just like vancomycin, right? So nephrotoxicity meaning like, hey, my levels for my kidneys are too high, right? And then at that point, it's like, what are the signs and symptoms of somebody who has nephrotoxicity, right? But you got to think about nephro, that means kidney, right? And then I come to the first one, the male with a creatinine of 1.7. Oh, okay, but but my creatinine levels tells me the function of what organ? I'm only guessing A. Okay, yeah, that's cool, Vicky. You can guess A. Right, kidneys, right? That's telling me the function of my kidneys, right? So that's how you can use those context clues. Dialysis tech here, A. All right, shout out to you. Who's that? Who said that? Portia? All right, cool. All right. So think about stuff like that. This is one that I could put in. So I'll give you another example. This is one of those like an aminoglycoside talking about nephrotoxicity is very common that you would see on NCLEX, right? But the the theophylline, right? Did I say that right? Somebody's going to correct me. Like, you may not see that as often. So it's just like, you have to know what everybody else knows. Not everybody may know that, but everybody has to know this. Okay. I'm so bad at answering nursing exam questions, but I know the information is so annoying. Well, that's what practice does. Okay. All right. So let's see what the answer is for somebody else. All right, here we go. It is A. You are correct. A male with a creatinine of 1.7 and a BUN of 52 on a 10-day regimen. Aminoglycosides preferably affect the proximal tubular cells. These agents are freely filtered by the glomeruli and quickly taken up by the proximal tubular epithelial cells, where they are incorporated into lysosomes after first interacting with phospholipids on the brush border membranes. Oh my God, talk about a mouthful. They exert their main toxic effects within the tubular cell by altering phospholipid metabolism. Uh, in addition, their direct effect on cells, aminoglycosides, causes renal vasoconstriction. I think the new NCLEX gives lab values, so that's good. They do give they do give the values, right? They give the values on the new NCLEX. They give the values on the new NCLEX for the case studies, right? Thank you. Also, do you go over NGN questions or just the classic ones? Right now, Valentina, I'm just going over these. And these essentially, so here's another thing that I would like to bring to everybody's attention, all 159 of y'all, that these type of questions, your multiple choice questions, have not gone away. Okay, so your select all that apply, your multiple choice, your drop down, your put in order, your dosage calculations, like those are still there. They have added other ones like highlights and closed questions and case studies and fill in the blank and multiple responses, so on and so forth. Okay, so these type of questions, although maybe worded differently, the multiple choice questions have not gone away. Okay, so it's the delivery of how the question is. It's the delivery of the question. Like, how is it being presented to you? That is what the biggest change is. Content hasn't changed. And if it has, it's so subtle you would never notice it. It's like 5%, 10%. Okay. So in regards to the NGN, I know that was a long-winded answer, but no, I haven't gone over those yet, but I'm working on those, especially for my course. Okay. So question 24, when assessing clients for evidence of penicillin allergy, which of the following symptoms may not be considered to be a true hypersensitivity reaction, right? So let's think about what penicillin is an antibiotic, right? It says, now remember, RTFQ, right? Which of the following symptoms may not be considered to be a true hypersensitivity? You could also reword it and answer it, which of the following symptoms may be considered to be a true hypersensitivity? In reality, you're going to be like, what's a true hypersensitivity? Okay, I know it's these three. Okay, now I know that this one is incorrect, right? So when I go back and I reread it, which of the following symptoms may not be? Okay, I know which ones are. So, how does it go? Like, one of these things belong like the other, or one of these things just isn't the same. So 3 of them are going to make sense and the other one's not. Okay. We got B. We got B's everywhere. B's. Oh, I get it. I literally get it now. Somebody posted a B in here and I was just like, what is that? And now, now I get it. Now I get it. All right. So we got B's all over the place. Hey, I appreciate everybody for the follows. What's RTFQ? Hey, y'all go ahead and let her know what RTFQ stands for. RTFQ. Haley says B. Thank you for the follow. Choir Boy, thank you for the follow. What does RTFQ stand for? Let her know. And that's what I tell everybody. All right. Pookie says B. Give it about another 10 seconds. See what we got. What else we got? Thank you for the follow. Appreciate it, guys. All right. What do we got? Let's see. Y'all doing God's work right now. Look, I'm just saying, I'm out here for y'all. We got B. What did it say? You're so slow, and it's the Queen's birthday as well. Beyonce. Oh, yeah, I am slow. I'm slow. I'm sorry. It's 100% C. Read. There you go, Kayla. Yes. There you go. All right, here we go. The answer is B. It is nausea. GI disturbance such as nausea are usually caused by direct irritation or overgrowth of gram-positive bacteria or yeast and are not indicated of a true penicillin allergy. Anaphylaxis characterized by, symptomatic hypotension with associated dyspnea, urticaria, oh my goodness, and possible gastrointestinal symptoms is the most severe manifestation of IEG, mediated drug allergy. It is most common after parenteral drug administration and is rare with oral or cutaneous exposure. Can we go back to the question? No, Joanna, we cannot. We're not on your time. Okay, but I'll go back to it. There you go. Shout out to all 247 of y'all in here rocking with me. Thank you guys all for following. Hey, we need 10,000 follows, so so we ain't ghetto out here. I'm just saying. So read the question. Now I know why I failed 3 times. What do you mean? What do you mean? Let us know. Tell us how you feel about it. I'm not even joking. I'm being for real. Like, tell us how you feel about it. I'm dead. Well, don't be dead. You got to be alive to be up in here answering. Yep. The answer was B. We're just going back because, apparently Joanna don't know how to read and she's slow and blah, 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 blah. There we go. All right. So yes, the answer was B. That was our rationale. I just read it. Haley, are you telling me what to do, Haley? I don't know. I don't know what that means. Are we on your time? Is that what we're doing? Oh, man. I ain't know we was on Haley time. Haley. Shame. Here we go. Question 25. All of the following symptoms are evidence of a super infection except, keyword being except. Oh, my God, I like you. Look, Kayla, I'm out here. I'm about it. I'm about this life. By this life, I mean this NCLEX life, because, I don't know what that other life is that they talk about. You know what I'm saying? So anyways, white oral plaques, creamy vaginal discharge. No idea why I want to laugh right now because I'm immature. Skin rash or darkened tongue. We got B, got D. Joanna, yeah, you did get it right. I don't know what you're talking about. Bianca put D. We got D. Okay, all right, cool. D. Natalie says D. Renee says D. Luke's mom says C. Jacob says A. We got B. Lydia says B. Sandy says D. Staying gal says D. Mari says B. B. What? Your live is flagged for harassment and bullying? What you mean, bro? Hey, somebody just flagged my live for being harassed. It says repeat violations could result in your live. Wow. Hey, somebody just flagged me for. Hey, y'all are wild out here. All right. Anyways, what we got? We got B's. We got D's. Hey, somebody just flagged me. I don't know what I did. Maybe. Yeah, that's cool. Anyways. We got B's. Y'all better leave him. Hey, look. Y'all better tell him. If I get, hey, I just want to let y'all know that for the fact that somebody just did that, I now have to wait another 30 days until I hit like 10,000 likes or follows or whatever before I can be on Ghetto and get over here. So I'm just letting you all know. So here we go. Let's see. So we got C, skin rash. Skin rashes are indicative of hypersensitivity reactions in clients on penicillin therapy. True penicillin allergy is rare, with the estimated frequency of anaphylaxis at 1 to 5 per 10,000 cases of penicillin therapy. Hypersensitivity is, wait a minute, did I go back? I felt like I went back. No, I'm in the right spot. Okay. Hypersensitivity is, however, its most important adverse reaction resulting in nausea, vomiting, oh my God, is it paresis? Oh my God. Urticaria, wheezing, laryngeal edema, and ultimately cardiovascular collapse. Look, I'm trying to tell y'all, I'm having a hard time right now trying to read these, but we making it out here. We making it. Shout out to all 250 y'all for rocking with me. Thank you for the likes. Yes. Keyword is super duper. Super infection, like what? Yep, like wash infection. There you go. Walk. Oh wait, I'm confused. Didn't it say which one is not? It did say which one is not. It did say which one. It said except. Yeah, there you go. Valencia, ma'am. Oh, you were explaining. Okay, I'm tracking. I got you. Do you help with any RN certification like CCRN in case? I don't, Lane. I don't. I actually have a buddy of mine who's actually working on his CCRN, and I think he's actually going to start teaching people on how to do that and how to prep. But I was working on my CNOR, but I don't know if I'm going to do that anymore. So because skin is hypersensitive, because skin is a hyperactive reaction, not super infection. Correct. Yes, you were right. Luke's mom. Got it. We need more questions. Joanna, first of all, stop yelling at me, okay? I'm glad I already passed the NCLEX because these study questions were stressful. It's all good. Yo, we did it. We did it, y'all. We did all 25. We did all 25 of the pharmacology NCLEX questions. Thank you for participating. I told y'all I was kind of sort of funny. Not really. You know what I'm saying? You liked and you gifted, so you got more questions and, and whatever. So I appreciate y'all. The new generation NCLEX is a breeze. So I appreciate everybody being here. Hey, like legit, it means the world to me that y'all came through. Like legit, like I literally was just like, man, what can I do to make myself relevant? But I like, what can I do that I enjoy? And I enjoy doing this, as well as giving you guys tips and all kinds of stuff about whatever that I know. I'll always talk about the 7-day NCLEX course because that's my baby. I will nurture that thing. I will nurture this child like I nurture my own. But my son's just older than the NCLEX course that I just created. But anyways, that's $48, 80% off. Check that out. Link is in the bio. For $48, you get it forever. You're helping. You are contributing to building the plane as it is flying. So we're trying to go from Spirit to Emirates, baby, because that's how we do. So I don't know how many people I gave it 600. I think 3 today. So I'm just letting y'all know. But once again, I don't gatekeep. I got these questions from nurselab.com. They're free. You guys can check them out. I believe they're the older questions, but regardless of them being the older question, these questions are still relevant because it allows you to sit, ponder, think, and all that stuff. Okay. Hey, but one more. It says been an RN for 32 years, but still love watching these videos. I appreciate. Is it Mama Llama? I appreciate you being here. Thank you so much. Hey, but one other thing. Hey, wait. I want more questions because I got more. I got more. I'm gonna need for y'all to do something. I'm gonna need for y'all to do something for me right now. Y'all better smash it. Y'all better start sharing. Hey, do it right now. I got more. Hey, your boy got more questions. What y'all want? Let me know. Y'all thought, hey, look. Y'all thought I was gonna leave y'all with just 25 questions? Huh? Y'all thought I was gonna leave y'all with just 25 questions? Come on now. And watch, some of them left. Some of y'all left. But y'all here with me, yo. Let's rock. You see what I'm saying? Hey, y'all want more? Hey, I got y'all. Let's go. There it is. Question number 26. Which of the following statements is true when educating clients about penicillin therapy? Is it A, the client must take the medication at evenly spaced intervals? Is it B, the client may save leftover medications for a future illness? Is it C, if signs of an allergic reaction, continue the medication and notify the healthcare provider? Or is it D, clients taking oral contraceptives must be cautioned to use an alternative form of birth control while being treated with penicillin? Lydia says B. Luke's mom says D. We got D. D. Amanda says D. Join through the, I don't even know what just happened. Join through an invite? What y'all mean out here? D. Cupcake, appreciate the follow. Thank you. I appreciate the follow. Thank you for all the love. Is that Genesis? That is a different way I've seen somebody spell Genesis, but hey, that's unique. So shout out to y'all. We got D. Nurse, follow the A. Shout out to you, nurse. Liz says A. Okay. All right. So remember, which of the following statements is true when educating, right? Is it Mayra or Myra? I think say Mayra. I'm not gonna, is it? Yeah. Okay. I got you. We good. You misread the question. Hey, what does RTFQ mean? Hey, if you're new here, welcome. My name is Kevin. I go by the Boot Nurse. We're doing NCLEX questions. Got these NCLEX questions from Nurses Lab. I'm just letting y'all know RTFQ, right? Make sure you guys are participating. We got A, we got some. So pretty much we got A and we got D. Crystal says D. All right, cool. So let's see what's going on. Let's see what the answer is. The answer is D. Clients taking oral contraceptives must be cautioned to use an alternative form of birth control while being treated with penicillin. Penicillin will reduce the effectiveness of birth control pills. Numerous antibiotics have been implicated in causing oral contraceptive failure by means of interfering with enterohepatic recirculation of, not even saying that word, not even, is it ethylene estradiol, whatever, bro. Y'all got it. The two groups of antibiotics most commonly involved in contraceptive failures are tetracyclines and penicillins, namely ampicillin. So think about this. We had a question like this earlier, did we not? We legit had a question like this earlier. I want to say it was like question, what? I don't know. We'll say like 9. We had it's like 9. It was like question 9. And so now when you go back and you see, like, you can only reconstitute a question or reuse a question and rewrite it so many times. You see what I'm saying? You can only do that so many times before you're just like, okay, bro, like I need something different, right? So, I mean, you've already seen it twice just in this practice, right, that we're doing right now. Okay. So shout out to all y'all that got the answer right. If you got the answer wrong, this is where you practice and read your rationale of why it's right. And then also read the other ones of why these answers are wrong. So you can acquire this knowledge so you don't make the same mistake twice. All right, cool. So, question number 27. Was that Antoinetta is taking anti-tubular. The most common adverse effect she may be experiencing is what? Okay, so this is back to pharmacology. What is an anti-tubular? Like, what does it look like? Like, what are the side effects, right? So A, you have red, orange discoloration of urine. B, hypersensitivity. C, hepatotoxicity. Or D, CHF. Yvonne, you're very welcome. Caring Mom, thank you for the follow. What does it say? To treat tuberculosis. That's right. Tuberculosis. Got A, we got C. Okay. Crystal says B, user 7. Oh man, answers are flying in. I can't even answer. Stangal says A. All right. Mayhemwithmel.com. Is that a real website? You say A. Olga, thank you for the follow. Appreciate you. Alyssa says A. Ray says A. Linda, I can't remember what you said. It says Kel Beauty. Thank you for the follow. Valencia says A, because I just want to let you know Valencia. Oh, that's a real website? Look, I'm about to go look. I mean, not right now, but later. I'm like, look. Or side effects. Correct. That's right. Show us the answer. Well, I gotta let people answer. I'm gonna need for y'all to like chill. Okay. Pay attention to the word, the most common adverse effect. That tells me that it's common. Is that what you said? Hey, look, who is that? Elf on a Shelf? Like, no lie, your emoji for your profile picture is throwing me off because you're saying like nice stuff and you're smiling, but I'm looking at it and I'm just like, yo, why are you looking at me like that? The answer is C. Hepatotoxicity. Hepatotoxicity is the most common side effect associated with anti-tubular agents. All first-line anti-tubular medications, is it a rifampin, ionized, or what is it, prio, y'all know what I'm talking about, and ethambutol can exert hepatotoxic effects. Yes, I just got here and I was right. Shout out to you, Michelle. She's like, hey, yo, what are we doing up here? A continual rise in liver function tests should prompt discontinuation of treatment. Liver function tests should be monitored routinely on anti-tubular medications that may cause hepatotoxic effects. Okay. About to ace this farm final at this point. That's what I'm talking about, Brittany. That's what I'm talking about. You better ace that final. I think I forgot everything from Farm 1. I'm going to need for you to unforget everything from Farm 1 because when you get to real life floor, they're going to be like, anti-tubular. And then you're going to be there the whole shift and you're going to be like, oh, why is my patient unresponsive? Because they have high liver issues and you're just like, oops, my bad. Alyssa, you better get it together. You understand me? You better get it together. Yeah, this finger's for you. You. All right, cool. I'm starting class in November 1st. Shout out to you, Georgia. It does. All right. Question number 28. In the treatment of tuberculosis, look at that. In the treatment of tuberculosis, the therapeutic rationale for combination drug therapy is A, decrease costs and improve compliance. B, reduce the incidence of cumulative effects. C is increased blood dyscrasia. Never heard that word before. That's actually very different. Or is it D, decrease emergence of drug-resistant strains? All right, we got D's. I appreciate y'all rocking with me while I'm over here. I'm dying. And I'm dying just because I'm tired. But it's all good because I'm here for y'all. Shout out to all 138 of y'all rocking with me. I'm over here giving y'all some more questions because, I'm rocking with y'all. I'm rocking with y'all because y'all rock with me. Thank you guys for the share. Man, I got 115 shares, 141,000 likes. Yo, y'all are killing it. Y'all are killing it tonight. Michelle says D. Kay says D. Okay. All right. Let's get some more answers up in here. Lisa says D. I had latent TB from a patient. Oh, Lord have mercy. Lord have mercy. Well, Minnesota mama, tell us what's up. Ma'am, did you just put E in here? That ain't even an answer. We got DD. Beto97 says A. Stangirl says D. E. Where do you see E? Where? Is your name Amari? Is it was Amari? How you say your name? Jalissa says B. Brianna says B. Cool. Let's see what's up. The answer is D. Decrease emergence of drug resistant or drug resistance restraints. Why put resistance and restraints together? Like, why do that? Combination therapy helps decrease the emergence of drug resistant strains. One major benefit of combination therapy is that they reduce the development of drug resistance since a pathogen or tumor is less likely to have resistance to multiple drugs simultaneously. D is my first choice. Then I second guess to B. Hey, so you have a better chance of sticking with your first answer. 9 times out of 10, your first answer is the correct answer. Michelle's the name. It says resistance strains, not restraints. I could have it says restraints right there. That's why I said that. And look, ma'am, my head is right. My head is a fog right now. Second guess is not good. It is not. Never change your answer. Absolutely, right? Never change your answer, right? So usually your first answer is the correct answer, right? Hey, and remember, this is practice. Even if you get it wrong, this is how you learn. This is how you're able to retain that information. Okay. All right. Question number 29. Change in visual acuity and color perception are associated with treatment by which of the following agents? You got ionize, you got PZA, ETH, or SM for streptomycin. What we got? Don't doubt your smart self. Look. Let her know. Let her know. Don't be doubting yourself out here. Don't doubt yourself out here. Luke's mom says A. User 72 says C. Alyssa says B. Ferb says C. User 72 says C. No Hope B. Shay says C. Joanna says, I think A. Hospice says A. Marty says C. Rolling Veins. No, your name ain't Rolling Veins. Says C. Neighborhood Nurse says A. Gabby says D. Okay. All right. So we a little bit all over the place. No idea. So I'm guessing C. Okay, Valencia. That's all right. It's ETHE for eyes. Okay. Is it Dina? That's a good way to remember that. I'm in pharmacy school. Oh, that's why you know that. Hey, but that's good to know. That's a good way to remember that, though, right? For the anti-tubulars, right? What is this? C equal E for equal eyes. Okay. Stangout says C. Oh my God, just tell us already. Look. Fine. It's C. ETH. It will cause changes in visual acuity and color perception. Remember E for eyes. Right. However, there are reports of cases of irreversible blindness due to the adverse effects of ETH associated optic neuropathy. Visual acuity testings such as baseline visual acuity, color vision, and Humphrey's vision field should be performed when administering EMB treatment and periodically during the regimen. Look at y'all. Dino over here dropping knowledge with the pharmacology. Ma'am, you should just teach this. I'm just saying. Thank you. Is it Erica? Thank you for the follow. Appreciate it. Victoria, thank you for the like. Y'all are liking. I appreciate y'all smashing that like button. Smashing it. All right. Question number 30. And look at that. Essentially, the last 2 or 3 have been all tuberculosis related medications, right? Which of the following groups are the first line agent, including the first line agents? A or D? Okay. Luke Mom says A or D. Haha. Anytime I ended up wrapping my answers. Got you. A. I graduated in 2025. No lie. I thought you said I graduated in 2025. I was like, you a time shifter? Like you already graduated and then you came back to just tell me that answer? Like what we doing out here? We got D. A because I have TB. Look, Abigail. Can I call you Abby? Abigail. Well, first of all, that sucks that you have TB. Okay. So I'm just going to say that. But secondly, that sucks that you have TB. A is my first guess. No, no. Okay. All right. What we got? We got A's. Beto says A. All right. It says up says A. Neighborhood nurse says A. Okay, cool. A. I'm guessing. I haven't started nursing school yet. That's okay. Yvonne says A. All right, cool. Let's see what the answer is before somebody decides they want to yell at me again. All right, the answer is A. These medications are used in combination as combination first line agents. Anti oh my god, anti-tubulars medications, rifampin, ionized. Is it pi? I'm just gonna call it PZA, whatever. Um, and what is it? EMB. Yeah, EMB are FDA approved for the treatment of Mycobacterium tuberculosis infection. The combination and duration on which medications to use for therapy rely on whether the patient has an active or latent disease. How long does it take? How long does what take? Remember ripe for, yep, there you go. That's right. Remember ripe to get your NCLEX results back. It could take 48 hours. Take up to 48. Some states you can actually get it back same day. I think Wisconsin is one of those where you take it and you can get it back like same day. Not me, a week on A&P in my first semester of school, and I'm on here like I know something. Look, come out here and answer these questions. You know something. Don't play this game. Peter, thank you. All right, cool. So I ain't even gonna lie to y'all. Your boy's getting tired, and I ain't even gonna lie to y'all. I have like 20 more questions, 20 more, but I ain't gonna make it. I ain't gonna make it because I got stuff I gotta do. All right. So right now we're going to pause this, and we're gonna not pause it, but we are going to reconvene with NCLEX questions on Wednesday at the same time. Okay. We're gonna reconvene. Joanna, you did that last time, and no. So that's what we're gonna do. We're gonna stop it right here. But hey, like I would say with everything, thank you for participating. Like I said, I'm kind of sort of funny. I had 25 questions for y'all, but I had the full thought process of going past 25 anyway. I just like messing with y'all because y'all are good sports. You know what I'm saying? So I appreciate all the likes. I appreciate all the follows. 7-day NCLEX course is out there. I gave a bunch of people 600s, and I don't gatekeep. If you guys want to know where to get these, you can check nurseslabs.com. Okay. So 5:30 Central Standard Time on Wednesday, we're going to go through the last 20 of these questions. Okay. So make sure you guys make sure you guys follow, and make sure you guys follow. Biggest thing is I need likes and follows because I need 10,000 people. You see what I'm saying? I need 10,000 people flat out, so we ain't got to do this get on this no more. Hey, now y'all can see my face. What's up? How y'all doing? My name is Kevin, boot nurse. Look. I just don't want to read these questions anymore, and I'm tired. But I would rather y'all see my face and somebody tell me I look like Jason Derulo or whatever other shit that y'all want to talk about. But hey, I'm here for y'all. Straight up. I have a question. What, Sandy? What you got? What? And it better not be a hard question because I don't know how to answer stuff. I saw someone doing the NPC the other day get so many. Because that's like the trend right now. Legit, that is the trend. And people are making a bunch of money off that, like legit. But I was just like, I can't do that because that's not where my thing is. You know what I'm saying? Thank you. I take my test Wednesday. This really helps. Stangal, ma'am, first of all, you better not do none of this NCLEX stuff tomorrow at all. You better just chill out, relax, do something else. All right. You're going to do just fine. You know the material. You've been practicing. I know you have. And, don't cram, because if you don't know it by now, you don't know it at all. I had an instructor tell me that a long time ago, and he was right. So I'm just keeping it all the way real. You're going to do just fine. Get some food and take a nap if you want. Look, I'm about to go eat and then go to sleep. Hey, Kevin, thanks for this. This is my first time on your page. Rolling Veins. First of all, ma'am, I appreciate you being here and coming to rock with us. We do this every 3 days. So Monday, Wednesday, Friday. I was trying to knock it down to 2 days, but I don't know if I can do that. You know what I'm saying? So, what does Sandy say? Should I sign up for my ATT or buy your NCLEX course first? So, Sandy, I'm gonna answer this question. First of all, you better sign up for your ATT regardless, because the longer that you put it off, the longer you're going to start to lose everything that you learned. Depending on when you take your NCLEX will depend on when you need to use my course. My course is filled with content right now, and it's getting filled with content as I'm starting to work on the new generation NCLEX stuff, as well as the review itself. So depending on when you take it will depend on, like, yeah, you can get the course or not. I'm new here and we'll be back. You better, Katie. The hell you think? Your name is Katie Salisbury? I don't know why I just laughed at that. I'm just kidding. But come back, Katie. Come back. Hang out. Hey, it's a good time. You know what I'm saying? I'm thinking about going to nursing school and I have no idea where to start. Any help is welcome. Well, you need to first ask yourself, like, why do you want to be a nurse? I tell everybody that. Sasha, I didn't even know you was gone. Girl, what you talking about? I'm ready to go home. Oh, I bet you are ready to go home. You about to get off? You know I'm about to get off. You know it. You know I'm about to get off. Like I said, I appreciate everybody. I'm almost done with nursing school. I can't wait to be. I bet you can't, because the one thing about nursing school, that nursing school itself, it is a journey. It is a massive, massive journey. And the best part about nursing school that I liked was when I was in clinicals, because I learned so much more while I was in clinicals. You know what I'm saying? But every single nurse has to go through the trials and tribulations of being in nursing school. Like one of those, I heard somebody say, "Hey, get off this beach." The fastest way through nursing school is to graduate. That is like you gotta get off the beach, right? You see what I'm saying? Yeah, Tippy, you are late. You already know where it's gonna be, though. You know it's gonna end up on YouTube, so you can go over there and check it out. This is my first time joining your live. I like your energy. Look, I'm about this. This is what I'm about all the time. Okay, I appreciate you being here, Mary, because I'm about this energy. And I'm about giving people a 600. I love banning people. Like, I don't know if it's a passive aggressive thing, but bro, when you come up over here and you start acting stupid, boy, I'm going to cuss you out and then I'm going to give you a 600. You see what I'm saying? So, best thing about nursing school was finishing and never going back. Facts. If you want to get through, the fastest way to get through nursing school is to get off the beach. And by getting off the beach, I mean, you need to push forward. That is the fastest way out of nursing school is to graduate. Okay. I'm in my first semester. It's week 2 and there's so much info. Just finished 12-hour study session. So is it anonymous 11? One thing, ma'am, I'll tell you is that you do have to take breaks. You have to take breaks. This is a muscle and you have to relax. But I understand it's like you don't know what you don't know. You don't know where to start. Nursing school doesn't always or if ever give you any type of direction because, in my opinion, I feel like they doesn't really give a damn about us. You know what I mean? So, get into it. Hey, everybody that's in nursing school right now, or everybody that's about to start nursing school right now, I need for y'all to listen up. Listen, I want you to hear me as I'm telling you this. You need to get into a group. And I ain't saying a big group. I don't give a fuck about what Beyonce's doing. I don't care that Taylor Swift did this. I don't give a fuck about the Combat Jail Girl and all the other. I don't want to hear that, right? And by that, I mean when you're in a group, you need to be in a group with, it needs to be 4 people, you included. So you and 3 other people. And you need to split the lectures up, all of the notes. You do 25%, everybody else do 25%. If you're not good at dosage calculations, that's just simple math, simple division or whatever, right? 25 times 4 is 100. And then bring them together and then learn off of one another. Get the team dynamic down at the beginning of nursing school. That way, when you go down to the floor, you'll already have some type of confidence as you're going through, your preceptorship or clinicals or anything like that. How do you not get nervous during presentations? So, Brandon, I've been an instructor for 8 years. So I was an instructor in the Navy. I was a surge tech instructor for 3.5 years. I'm also a master trainer. So I've been a master trainer for 7 years, became an instructor in 2015, got my master certification as an instructor in 2016. And I have been honing in on my public speaking. I actually really like it. I really like it. And I think it's more because I understand like the lingo and I'm also relatable. Like some people, like, you get these old ass fucking professors that are up there and they start talking like, some shit from the 70s or 80s or the 90s. Granted, hey, shout out to the 90s. But it's just like, it's just like they're not relevant. You know what I'm saying? So I'm going to be relevant and I'm going to tell you my experiences and I'm going to tell you what I know you're going to go through because I graduated nursing school in 2018. right? So that's how I've gotten really good at my presentations, is because I've been teaching. I taught surgical technology. I'm a trauma nurse instructor. I taught BLS, ACLS, advanced burn, pre-hospital trauma, tactical combat casualty care in the Navy. Um, I'm used to herding cats. I used to be a clinical coordinator when I was in a search tech program. So I've done a lot of things involved with, just in the education aspect. There's 14 chapters on the first exam. Why? That's a good damn question. It's terrible. Questions over. Yep, that's facts. Don't study to memorize, study to understand. Facts. Can I still study with your course for my exit? Also, please, because I'm studying for my exit now. You could, right? But I'll be completely honest with you. It may not be it. Like, everything that you need for your exit may not be in there. That's what I'm saying. So it all just depends on when you're graduating, when you're taking your exit, so on and so forth. I have to see who's serious because it's only week 2. That's true. So you got to fill everybody out. I started off in multiple groups, and there was 130 people in our cohort, and out of the 130, there were 11 or 14 guys. I stood out. I went from multiple groups. So many people were scared to share notes because they were afraid they were going to cheat, or that it was considered cheating. Like, people were so like on edge. And then I ended up finding my one group completely by accident. And I still rock with those girls to this day, every so often. It's kind of like we have a trauma bond, and we end up, we hang out. I mean, but we don't, but we talk to each other. We still have a group chat. So I didn't even start yet. I got 2 on my team already. Hope they study, because I don't got time to waste. That's right. So many old professors. I remember them like it. Yeah. I'm scared, but I'm going to do this and become a nurse. That's facts. You know what I'm saying? Hey, you can be scared. What I say to people, hey, if you're scared, go to church. Because you being scared is not going to stop the inevitable of happening. You being fearful is not going to stop the inevitable of you happening. The inevitable of it happening. You got to go to nursing school. You got to go through the trials. You got to do all that. Don't make me repeat myself. What you mean? What, Sasha? What you say? For real, you should sell your shirt. I would definitely buy it. Oh, Joanna, if you want. So everybody go to thebootnurse.com. Okay. And then go up to the top where it says store. Okay. If you go up to the top where it says store, it will take you to all of the apparel, to include this shirt, one of these shirts. Okay. Might be a dumb question, but can you do ACLS as a CNA? That's a good question. I think you can. I mean, but in reality, you can't do any of the ACLS algorithms. Like, you can't push meds. You can't do the AED. Well, no. Yeah, you can't do the AED because they do it on a different mode. Only thing you really do is chest compressions. But if you wanted to do you should be able to do ACLS. It says, for some reason, I need to know my stuff first before joining groups. That's fine. If that's what you need to do, to this day. To this day! I'm sorry. Trauma bond, that's exactly what it is. Facts. That is nice. No, you can't? Okay, cool. I'm a CNA, and you can only do BLS CPR. Okay. Remember to have humility. Facts. Admit what you don't know, or if you need a refresher on something. That's a big fact. Shout out to Kimmy for that, because that's true. A lot of people get embarrassed and they're just like, no, I got it. But then they get up there and perform, and then they fuck up, right? So it's okay for you to say, I don't know. I used to ask people, hey, do you understand me? And then they would look at me, and they wouldn't know what to say. And I'm just like, hey, East and West is okay. North and South is also okay. You know what I mean? Can introverts become good nurses? Yes. However, you have to be able to understand what type of environment that you're getting yourself into if you are an introvert. If you don't like people, your first year to 3 years is going to be patient care, if that's where you want to. It all just depends on what your goals are. But can an introvert be a good nurse? Absolutely. But here's what makes a good nurse: your attitude, your knowledge. Can you have humility? That's what makes a good nurse, right? Your personality makes you a good nurse. You being rogue does not make you a good nurse. You being an asshole does not make you a good nurse. I mean, you could be good at the skills, but if you're an asshole, who the fuck's going to want to work with you? You know what I mean? So what makes a good nurse is the overall person. People, and trust me, a lot of people aren't going to be your cup of tea, and that's okay. Because there's a lot of people that are not mine. And I know people that don't like me because they've told me, and I'm just like, okay. You know what I mean? What's your favorite specialty? Like, where do you like to work? So, Katie, I've worked in the ICU. Specifically, I've worked in a burn ICU, a medical, and a neuro ICU. I've worked in the PACU, and I've worked in the operating room. Out of all of those, I like the PACU. That was my favorite spot to work at. Um, but it all just depends. Like I said, like some people are just like, man, I don't know what's a good spot for me to go. And I was just like, I don't know. Where do you want to go? Somebody like, oh, I want to go to labor and delivery. I'm like, all right, cool. You'll never catch me in labor and delivery, ever, right? I wanted to do end of life care of NICU. Okay, gonna head to work. Great stuff today. Thank you. You're welcome, Victoria. It's always great to see you, or great to have you here. Obviously, I can't see you except for that small ass little picture that's in the corner. But end of life of NICU. Okay, I was picking up what you were putting down, Katie. I got you. But if that's where you want to go, then you definitely can do that. You would have to do a bunch of research for yourself to figure out how to get to end of life care for NICU babies, because they're already having a rough time. There's a lot of transference of emotions that happen in ICUs, or that just happen in people that are passing away. Period, and that shit is real. So he's like, you got to be one tough person for that. So. But shout out to all 57 of y'all still rocking with me. I appreciate everybody coming through to look at the NCLEX questions. Hey, if you're new here, my name's Kevin. I go by the Boot Nurse. Check me out on all those social media platforms. Somebody was asking about the shirt. I think Joanna was. If you guys want to know where the shirts are, just go to my link tree, go to my website, thebootnurse.com, and go to the store, and it'll take you there. I probably should just put a link in there that'll just take you straight there anyway. But go fish, go surf the internet and look at some things. Okay. But I want to know who you are, where you're from. I'm going to hang out here for about another 5 minutes. I want to know who you are, where you're from, what other questions that you guys have, because it's almost time for your boy to sign off. And Sasha was asking as well. What was Sasha asking? What did I miss, yo? What did I miss? I know Sasha about to be mad. She probably sent me a DM like, I know you heard what I said. Don't make me repeat myself. Ma'am, hold on. I got to go back and see what you said. Can you send me the shirt, sir? I don't care. I don't care about nothing else. Size XL. Ma'am. Oh, she was asking about the shirt. Yeah, so the shirt, thebootnurse.com. Thebootnurse.com. Go to the store and you'll find it. I want to be a nurse because I am a hospice CNA and I think that's the next step. Hey, it's either you think or you know. You're hesitating. You're like, I think that's the next step. You literally just said a fact of what you want to do to an opinion of you think that you want to do it. No, you want to be a nurse and you know that's the next step. And so that's what you need to do for yourself. If that is what you want to do. So, but Katie, yeah, that's where the shirts are. Go check them out. Check them out. I actually picked a really good fabric too. That's why some people were just like, man, they're kind of expensive. I was like, bro, groceries are going up. Eggs were $6 a carton and you mad about a t-shirt? I can't help you there. I can't help you there. I'm just being all the way honest. Okay. So, what else y'all got? I got 49 folks up in here. Yo, I just want to let y'all know we had like 300 people come through. We had 300 people come through to sit here and listen to me run my mouth about NCLEX questions. And essentially about how to help y'all. Okay. So yeah, hopefully I get close to that 10,000, those 10,000 followers. And actually I'm going to start dropping TikToks of like NCLEX style or NCLEX questions, kind of like these. That way, hey, if you don't come to the live or if you don't go to the YouTube, at least you'll have a quick video where you can answer it. And then I'll post the answers. I think people will like that as well. If you like that, smash that like button. You know what I'm saying? How was your day? Very tiring, I bet. Yeah. I woke up at 7:30. My son woke up, and I've been recording content all day. I think I recorded like 5 to 7 videos. Each of them are like an hour a piece. Like raw footage is like an hour. Like the shit is wild. And then I was tired. And then as soon as I started talking, it's like I got my second wind. You know what I'm saying? The energy here is real, and I'm glad I stopped by. I'm glad you stopped by too. I'm just saying, yes, I do love videos like that. All right, Katie, you got it. Well, I'm gonna make them happen. Not good at skills in the lab, but good with the lecture. Worried about going into nursing in the real world. So here's the thing, Haley, is that You have to dive in. You cannot be timid, right? And you need to always ask questions. I don't give a damn how many times you ask the question. So you're not good at the skills. Well, get good at the skills. So that way, when you go to nursing in the real world, you won't suck. This is why some people don't get along with me, is because sometimes I could be very passive aggressive. I'll be like, man, Haley, I understand, but you better get it the fuck together. And that's all with just love, you know what I'm saying? And a lot of this comes out, because it just does. But some people need that. Some people need that push, right? That's why I love education. That's why I love teaching. That's why I love doing, being a preceptor. That's why I love doing the labs and simulations. Love it. Love it. You know what I'm saying? Like, I'm very blunt, but I'm respectful, right? I'm like, there's some people that are just like, that just don't know how to talk to people, and they're rude. And it's just like, look, everybody has to have a different approach. And that's what I learned since I've been an instructor, that you have to approach differently, because everybody is not going to receive the message that you're trying to deliver, right? Amanda said, I graduated with my BSN in 2019 and I have failed the NCLEX several times. I have lost motivation and come across this TikTok live that has given me hope. Hey, Amanda. Hey, y'all ready for the passive aggressiveness? I'm going to tell you something right now. First of all, I'm glad that you stopped by, Amanda. Amanda, I'm talking specifically to you right now. I'm glad that you stopped by. Right? So I'm glad that you stopped by and you failed your NCLEX multiple times. I just want to let you know that everything is your fault. Everything is your fault. Okay? But, and there is a big but, what are you going to do to fix it? And let's just say it's not your fault, which it is. Let's just say it's not your fault. And what are you going to do about it? So think about that. What was your time schedule like? What was your life like? Did you have any environmental issues? Did you have a good support system? Did you go through a divorce? Do you have children? Do you have a job? Because like, all these things matter, right? All of these things matter. Do you not understand NCLEX style questions? Did you not take in enough content? Do you lack the discipline? Do you lack the accountability? Right? Like, those are the things. Like, it is taking this exam. It's not just about passing it. I'm telling y'all that right now. It is not just about passing this exam, right? It's about conquering this exam. And I say this all the time. All the time. You're the one who said you wanted to be a nurse. You're the one who had to do the prerequisites. You're the one who had to do the entrance exam. You're the one who got through school, the fucking trials and tribulations of that terrible journey, but you made it. You graduated, right? You went through the clinicals, you graduated. And now you're at the last leg. Like, you can see the finish line right there. You can see the peak of this mountain right there. So my question is, why are we stopping? And the answer should be very simple. It's like, we're not stopping, right? So you need to ask yourself those questions. Okay? My mom passed away while I was in nursing school. I'm sorry to hear that. And that is huge. That is huge. That is huge. And I'm sorry to hear that. And I'm feeling like my life was a blur during those years, and I'm going to continue to follow you and keep going towards passing. Yet, that's what I'm talking about. Amanda, you didn't even have to tell me that. You did not have to tell me that. That just gave me goosebumps. Because your mom passing away, and I don't know how your relationship is or how it was with your mom, right? And I'm assuming by you telling me that she was an integral part of your life, right? And so that could be tough. That's what we call an environmental distraction. A valid environmental distraction at that. However, it does not matter, because it's still your fault. But in the end, right? What are you going to do about it? And sometimes it takes somebody like me to say that, because it took somebody to say that shit to me, because my grandpa died when I was in school. So I understand that. I do understand that. I was going through a rocky relationship, ended up getting a divorce. You know what I'm saying? I understand how that feels. I failed my exam 3 times. And the only person to blame was me. I was trying to sit here and try to blame UWorld, trying to blame Mark Klimick, trying to blame Saunders, Hesse. As a matter of fact, Hesse is trash. ATI is trash. I don't give a fuck. Anyways, y'all know, you see what I'm saying, right? But in the end, it's my fault. It's because I couldn't retain the information. I had all these other distractions going on, right? And no matter what, you'll still have that thought process about your mom. Because now your mom, that traumatic experience is associated with nursing school. The one thing that I'll say that people used to say to me, because I'm a military guy, I've been in the Navy for 16 years. And like I said, if the fastest way to get through nursing school is to graduate. During World War II, when Omaha Beach happened, talking about that in D-Day, the Germans were like firing all on the Americans and all the Allied forces on the beach. And there was one colonel that said, the fastest way, or if you want to live, get off this beach. You see what I'm saying? If you want to live, you got to get off this beach. The fastest way home is off this beach. The fastest way to you being a nurse is getting off that beach. You see what I'm saying? And you're almost off the beach. You're almost off. But sometimes it takes a little of encouragement and kind words and understanding, because obviously your school don't give a fuck about you. You see what I'm saying? It takes somebody who has been in your shoes, who has failed, who has been through nursing school, who has their own traumatic experiences to help push you through that. Not help, but kind of just, give you a nudge. You know what I mean? So I'm going to pass my damn NCLEX and become a damn nurse. Enough is enough. Time to hold myself accountable. Yes, ma'am. That's exactly what it is. Thank you for reserve. Thank you for reserve. Thank you guys for the support. I always appreciate it. On the road to retirement. So we'll see how that goes. But Amanda, once again, I appreciate you sharing that, and come through, hang out with us, and, although you have those traumatic things that'll happen to you, it gets better. It does get better. And I know that you have, when you have people that are like that in your life, especially if they're an intricate part that, like that, that's tough. And, some people just can't get over that. But you got to live for you. You got to live for you, because that's what they would want for you, right? When my dad died, I had PTSD seeing his postmortem. I'm now in nursing school pursuing hospice. Look at that. So you saw your dad pass away, and now you want to be a hospice nurse because you want to essentially treat hospice patients, essentially either how your dad was treated or how your dad was not treated. And it happens. You can do this, Amanda, and use your experience to help others. Facts, 100%. As soon as you get out there, you start taking care of patients, start moving around. Do you. Don't let these hospitals take advantage of you. Don't let these hospitals disrespect you. Get your skills. Go do you. Did you take your NCLEX after your ADN or BSN? I went straight for my BSN because I was active duty in the Navy at the time. Yes, I went to active duty. I'm sorry. Yes, I went through nursing school, a BSN program, an accelerated BSN program while I was active duty in the Navy. So I was working full time while I was doing that. And it was I could only do bachelor's because I was trying to become a commissioned officer, and they only take BSN nurses, not ADN nurses. But I didn't even know ADN nurses existed at all until I until I was in nursing school. I was like, what the hell? You know what I mean? So my dad was in kidney failure, and I knew he would pass, but I wasn't prepared for how he would look after. Yeah. It'll do that to you. Like when you first see somebody who's post-mortem, I've seen enough death to last me 2 lifetimes, from military stuff to, working in ICU during the second wave of COVID, as well as in the burn ICU, especially, even in neuro, and even, on the medical side where there was no COVID involved, so like those things are kind of burned into your head. So what are you going to do with it? Are you going to let it fuel you, or are you going to let it hold you back? You know? And that goes for Amanda as well. So same thing. No one told us you could your NCLEX right after ADN and then go online. Facts. If I would have known I could go and get my that I could go and get my ADN at 2 years and then go online to do self-paced BSN, I would have did that. I would have done that in a heartbeat. So I want to try to prevent people from seeing loved ones like that. Yes, for sure. Absolutely. Absolutely. And that's good. Shout out to y'all. Look, I really said I was going to get off here like 10 minutes ago. And then boom, here comes Amanda telling me everything, which I appreciate. So shout out to all 37 of y'all that are still rocking with me. Y'all got me to 46,000 likes. Like, y'all really don't understand how much I appreciate that. Like, legit. Y'all really don't understand how much I appreciate that. Because, I'm working on something big for myself, but I'm doing it for y'all, like for other people, because that's what my passion's been for a very long time. Hi, is it Lega or Liga? I'm in week 6 of my ICU orientation as a new grad, and today was a tough one. Do you have any advice? Liga, I'm gonna be completely honest with you right now, and probably for the next year, you are in what we call the imposter. You have imposter syndrome, right? Every nurse gets it. Every nurse, especially in the ICU where you go straight to critical care, every nurse has imposter syndrome. I know you feel it. You don't even have to tell me that you feel it, because I know you feel like, I don't belong here. I don't know nothing. What was I thinking, right? I got all these people that know more than me. But everybody has to go through that phase. I went through it, because trust me, there were so many days I went home and I was standing in the shower and I was just like, damn, bro, like, what the hell am I doing? Alarm fatigue. I could hear alarms. I could hear code blues going off in my ear, waking me up out of my sleep. Look, the shit is real. It is real. It's a real fucking deal out here. You know what I mean? So the one thing that I could tell you is that take mental breaks for yourself. Do things when you get home. Like if you have your 2 days or 3 days off or whatever, do things that are conducive to your mental health. Like go hang out with friends, go to brunch, debriefs. I don't know if you work nights or if you work days, but debriefs are huge. Like, I have a trauma bond with these girls that I worked with in the ICU, and we used to go to eat brunch every morning. Well, every morning. It got expensive after a while, but we used to go to eat brunch afterwards. And we would sit there and we would talk about how much we hated our fucking jobs and how much we hated being nurses. But at the end of the day, it was just us venting and us talking about the stupidity of other nurses and the stupidity of the administration, to the charge nurse, to other nurses, to each other. We needed that. And I would recommend that you have that as well. Like, not try to be a mean girl with people, but find somebody that understands the road that you've walked down, and, vent. If you need to get other additional help for yourself, like mental health, go talk to somebody, I would recommend do that. I have no shame in telling nobody that I talk to somebody, once a month or once every 2 or 3 weeks. Like, I've literally drove home in complete silence. Who in the hell does that? I've drove home at night. I've drove home from my shift after a night shift, and I drove home with no music. Who the fuck does that? So that would be my advice to you. I know I was kind of going all over the place, but Liga, that would be my advice to you. I know you're going to get off soon, bro. I know you're tired. I am. I'm about to get off. Full-time nursing student and service. Kudos to you. Look, life is short, and mine felt like it was around that time, but it's doable. Thank you. Really appreciate the advice. You're very welcome. Like driving home and just screaming as loud as you can, windows up, and hopefully no one can look. There was times where we went to go eat breakfast, and the server knew us so much he would bring us drinks, like free drinks. And we're just like, nah, you're about to open up a can of worms, bro. We can't be doing all that. Or he would see us and he was just like, usual order, and we're like, yeah. And he would hook us up, because it happens, But anyways, Amanda, you are very welcome. I hope you have a great night as well. And come back to the TikTok on Wednesday at 17:30 Central Standard Time, Texas time. That's how we do it. So, all right. I got 33 people that's still rocking with me. Shout out to the 47,000. That's the most likes I've ever had. And all we're doing is going up, and I love it. I love it. I love it. I love it. But my last little plug for myself. Matilda, boo, you late. You are late. I'm about to get off. But you already know where the video is going to be. Check out YouTube if you want to go check it out if you get time. Good night. Thank you. You're well. Good night to you as well. Thank you. But of course, my name is Kevin. I go by the Boot Nurse on all platforms. Make sure you guys go check it out. And if you are a new nurse or about to start school or anything like that, and you don't take your NCLEX for another 6 months, 12 months, 2 years, whatever, check out the 7-day NCLEX course. The link is in my link tree in my bio. It's the first one once you click in there, and you can't miss it. It's for $48. It's 80% off of its original price. So once you get it forever. Y'all are helping me go from Spirit Airline to Emirates, baby. That's what we're doing. So I appreciate everybody. Make sure you guys come back. I hope you guys have had a good Labor Day weekend, as well as I hope everybody has a good rest of your couple of days. And I will see everybody else. Yeah, Misha, I'm about to get off right now, but I will see everybody else on Wednesday, 5:30. All right. You guys have a great night. Bye.